Okay, at the beginning,
will now be recorded.
I request all participants to kindly keep their mics in mute mode and to switch off their videos. Okay, I request all participants to kindly please mute. I request all participants to kindly put their mic in mute mode and switch and the cameras put off your cameras. Okay, as and when you speak, please then you can switch on your camera as well as mic. The information you all. Kindly mute your mics. Okay, so we start. On behalf of International Society of Sustainable Waste Management, Air and Water, ISWMAW, and its collaborator from Nigeria and India, namely University of Ilorin, Nigeria, Covenant University, Nigeria, Center for Sustainable Technologies, Indian Institute of Science, Bangalore, Center for Sustainable Development and Resource Efficiency Management, Jadavpur University, Consortium of Researchers in International Collaboration, CRIC, Lagos State University Protection Agency, LASEPA, Nigerian Institute of Environmental Engineers, NIEE, Lower Nigeria River Basin Development Authority, LNRBA, Association of Professional Women Engineers of Nigeria, APWEN, Waste Management Society of Nigeria, WAMATHON. I, Dr. Shutripta Sarkar, along with the organizer Ipshita Shah, welcome all the speakers, panelists, participants from various organizations to the IconSWM's India-Nigeria Connect webinar, Resource Circulation and Waste Management under Pandemic COVID-19. This webinar is the third pre-event of the 10th IconSWM. I am handing over the microphone to Engineer Yusuf Majolagbe to proceed further. Engineer Yusuf, please proceed.
Okay.
Thank you.
Thank you very much. Good morning, Nigeria. Good afternoon, India. Distinguished participants and facilitators. Against the backdrop of escalating pandemic COVID-19, which originated from Wuhan, China, we feel it is our duty and responsibility to extend our support and care to common people who are facing difficulties in everyday living, staying far from the heart of the city, perhaps in isolation centers, and disconnected from regular communication in these trying times. The objective of the webinar is to discuss the waste management issues and challenges related to the protection of people and the environment from the effects of COVID-19, as well as the resource circulation that is taking place in these two collaborating countries, India and Nigeria. We are very glad to announce that more than 900 participants from 24 countries have registered and are participating in this webinar through the webinar platform and the Facebook live streaming of International Society of Waste Management, Air and Water, and of course, our collaborating organizations. We are pleased to inform you that we have a group of very distinguished expert speakers and panelists in this webinar. I'd like to inform that all the participants who have registered and are attending the webinar through the GoToMeeting and Facebook live streaming will be given a certificate of attendance as per our database. At this junction, I'd like to cordially invite you all, the participants, to submit articles and join the virtual Fiscal Conference, which is the 10th International Conference on Sustainable Waste Management towards Circular Economy, which is to be held in December between the 2nd and the 4th of December 2020 at Kolkata, India. The submission date of full article is the 31st of September 2020. The details of which will be sent to you and are available on our website www.iswmaw.com. It is important to note that all participants in the webinar are to remain in the default mute mode. Speakers will unmute only when requested. Questions and queries may be asked only in the chat box to specific speakers or panelists, which will be handled by the rapporteurs and the coordinators. On request, the camera may be put on, else it will be off. So let us endeavor to put off our cameras to get the best of the network. Moving on to the inaugural session, I am pleased to invite Dr. Adeni Said Aremu, the MD of Lower Niger River Basin Development Authority, Nigeria, to moderate the inaugural session and kindly deliver a welcome speech. Before I hand over the invisible microphone, I'd like to introduce Dr. Aremu. So in brief, Engineer Dr. Adeni Said Aremu, a fellow of the Nigerian Society of Engineers, is an associate professor in the Department of Water Resources and Environmental Engineering, University of Ilorin, Nigeria. He is presently on leave of absence as the Managing Director of Lower Niger River Basin Development Authority, Ilorin. He has to his credit 40 articles in areas of water resources engineering and solid waste management. Dr. Aremu, kindly unmute, and the floor is yours now in the next 10 minutes. Thank you.
Thank you, Engineer Yusuf Majolagbe. You are all welcome to this first India-Nigeria Connect webinar, which is an online educational presentation platform. The title is, as Engineer Yusuf has said, is Resource Circulation and Waste Management under COVID-19 pandemic. As we are all aware, today marks an historical event between Nigeria, India, and the rest of the world, as we are here to discuss something that is very, very important to us. As year 2020, we are witnessing COVID-19 pandemic. I welcome you all to this program, and this is a inaugural session. We have quite a number of speakers here, seasoned professionals, who are going to take us through this session. And its technical section will feature speeches by 3 people: Professor Olubunmi MOKUOLU, Mr. Sanjay Garg, and Professor David Olukanni. While the other session, which is the panels discussion session, will be for 60 minutes, and we have quite a number of panelists. I must tell you, as Engineer Yusuf has said earlier, that this is a pre-event of the 10th International Conference on Sustainable Waste Management towards circular economy. At this junction, I want to introduce to us the key facilitator of this program and the person who has put all this together, this recipe together, is in person of Professor Sanjay Ghosh. He is the chairman of this occasion and is also going to deliver the keynote keynote speech. Professor Dr. Sadhan Ghosh is a professor of mechanical engineering and the founding chief coordinator of the Center for Sustainable Development and Resource Efficiency Management, Jadavpur University. He has served as the Dean, Faculty of Engineering and Technology, and also the head, Mechanical Engineering, the Director, CBWE, Ministry of Labor and Employment, Government of India and Industry. He has a lot to his credit, and he is a man of many facets. He is internationally renowned. He is an internationally renowned personality in the field of waste management, circular economy, green manufacturing, supply chain management, sustainable development, co-processing of waste, plastic waste, and e-waste management, recycling, ISO standards, and TQM. Professor Ghosh is the president of the ISWMAW, that's International Society of Waste Management, Air and Water, who is the key an organization who is the key collaborating agency with other collaborating organizations earlier mentioned. Is also the president of the Consortium of Researchers in International Collaboration, that is CRIC. Professor Ghosh has received several awards and patents. He has written 9 books. He has edited 40 volumes, and he has over 220 national and international articles to his credit. He is also the associate editor of a renowned journal, IconSWM. He is a consultant and international expert of UNCRD, DESA, APO, Japan, China Productivity Council, SACEP Sri Lanka, IGES Japan, and a host of others. He is also a convener of the ISO TSC 61WG2, an active member in the India Mirror Committee of ISO TC 207 and ISO TC 275. You agree with me that he's the man of many colors? He has been instrumental to the International Conference on Sustainable Waste Management towards the circular economy, and also the IconSolid Waste Management movement worldwide. And it has been involved in several collaborative research with over 40 countries in the last 3 decades. At this junction, distinguished participants and presenters from all over the globe, I want to welcome Professor Ghosh to speak for 20 minutes. Thank you. Over to you, Professor Ghosh.
Thank you, Dr. Buraimoh. And I request the organizer to give me the presenter's permission. Yeah. This is okay. No? Yeah. All right. So thank you very much, Dr. Buraimoh, once again for giving me the opportunity to speak here and for a nice introduction. But before I start, I like to thank my co-organizers from Nigeria and India who have really made this webinar happen. Because as I was reported by my secretary that in the morning when we start this program, there are around 903 participants who registered and who are witnessing this program through the webinar platform as well as Facebook live streaming. So I must congratulate my partners in Nigeria for making this happen. And specifically some of my friends who have really done this job is Dr. Buraimoh, Mr. Yusuf, David, Ozouro, and many others. I mean, whom I did not mention now because I could not remember all the names, but they have done a great job. Why we are holding this program and what is the objective of this program? As Dr. Buraimoh mentioned, that now we are really facing a great challenge throughout the world. Each of the countries have its own problem. So in this situation, everybody, whatever are the activities are carried out, are thinking on the side of it, what would happen during this pandemic COVID-19 for the particular activity. Each of the activities are so correlated with this situation that we cannot avoid. Whenever we talk about any subject, we must refer to the condition through which we are going. And as a matter of fact, that's why though our main concern is resource circulation and waste management in India and Nigeria, we are also considering what would happen and what is happening under this pandemic COVID. And this program we are taking up with different countries to make people aware that what is happening throughout the world. And this is one of the, this is the third pre-event of International Conference on Sustainable Waste Management towards Circular Economy. And there are several programs in series. So let me first go through that there are only a few areas of concern in my deliberation. I will speak on COVID-19, what is happening in India, in summary, in nutshell, and then I'll go to speak on what is happening with respect to the circular economy and resource circulation implementation in India. This is really a global tragedy of the century. And we know the origin. When in December end, we got the news that Wuhan, China, some virus, coronavirus has evolved, and in no time, it has spread throughout the world. And in last 6 months, we have seen thousands of people who died even out of this coronavirus. It it is not only the people are dying, it is not only the health issue, it is related to the healthcare system, it is related to the industrial activities, it is related to the educational activities, and it has been observed, specifically in India, what we have been observing, that the education system has been just collapsed because of this coronavirus. For if you consider that for a couple of months, there is no classes in the college and schools. What will happen to the budding citizen of the country? So in that way, today, the situation is such that we have to consider first the savings of life. And on the other hand, we have to also consider many other things, like if we cannot have the industrial activities, people cannot survive for a long time. It is not only the effect of coronavirus, but due to the effect of coronavirus, the secondary effect is the people will starve if there is no industrial activities. People will be affected if the waste management is not taken care of very seriously. So in that way, though we are concerned with COVID-19 aspects very much, we have to concern with all other things together. And that's the thing. But today, we have to take an oath. We have to identify and destroy the source that is responsible for this pandemic disaster for the whole world. There are some modes of transmission each of us throughout the world knows by now, even the child. But to have to make a memorization, I like to mention that there are hygiene, hand hygiene, respiratory hygiene, social distancing, high risk group segregation, and quarantine. So all these things are there, and I'm not putting my time on this, because today everybody knows that to save oneself, the hand hygiene, respiratory hygiene, social distancing are must. And in India, we have been experiencing number of lockdown throughout the country, in some of the cases in isolation, and some of the cases even a particular person is also isolated due to affection, as he or she is affected by this COVID-19. So it is a situation when the child who has taken birth today to the person who is ailing at the age of 90 or even 100, everybody is concerned about the coronavirus or the COVID-19. So what happens to the waste management in this situation? You know that most importantly, the waste generation during this COVID-19 pandemic is very, very high, mainly whenever you consider the plastics. We know that plastic is really a menace throughout the world. But whenever this COVID-19 comes, the content or the amount of plastics goes higher, nearly 30 to 40% in some of the cities. So why it is happening? Because you know that we are quarantined. People are under lockdown. So in that way, they are not in a position to go out. So even today, all the materials which could be purchased from the shop, they are coming to the own house with some packaging and other things. So in that way, there are some data that 5,500 tons per day to 6,300 tons per day, that is the 15% hike in the plastic packaging in Thailand and Singapore, India, everywhere this is the situation. But what are the types of materials which are creating problem during this COVID-19? As I was mentioning, that plastic is one of the very important issue with respect to the plastic COVID-19 is concerned. The main COVID waste are mostly the single-use plastics. You know, in India in 2018, we had the slogan that beat the plastic pollution, and our Honorable Prime Minister has announced that by 2022, we will make the single-use plastic to zero. But this pandemic again created a lot of issues with respect to the use of single-use plastics like masks, PPEs, and many other items which are used during this treatment are made of plastics. So huge plastics is generated. So we have to think of it how this can be managed, and also the circular economy implementation or the resource circulation can be implemented here. So in that way, the simple and the flowchart of COVID-19 waste is, the first and foremost thing is it has to be segregated. If the waste is segregated as in the waste management strategy, then many of the problems of the COVID-19 waste is also solved. So this is a flowchart which I have shown. The COVID-19 waste generated, it will go to the segregation section and sorting. Then it goes to whether it is infectious or non-infectious, and accordingly it will go. But for non-infectious, though it is not happening today, but there is every possibility that it may go for the recycling. So we have to avoid going for the recycling of this non-infectious, because we are not sure whether really this has been disinfected or not. So in that way, one of the areas of concern is co-processing in cement plant or the waste to energy plants. But again, the people who are handling this waste in these plants are also at the risk. So it has to be 100% sure that the disinfection of this waste is done here. And if it is infectious, then we have the biomedical waste facility and go for incineration or under controlled environment. But again, one thing has to be kept in mind for all the countries, that no recycling for COVID waste is advisable by any way. And the second thing is, the main concern is segregation. In India and in many countries, we have the biomedical waste management system. And I'm not going into the detail of this because Mr. Garg is there as a speaker, so he will take care of the biomedical waste management in India, and he is also from the plant, so he knows. He will give a very good insight of this. But we have a good system of biomedical waste management by segregation, and each of the segregated material is also going to, this is for biomedical waste incineration, this is for treatment, and something which will go to the final sink. So again, the main grammar of biomedical waste or the COVID waste is the segregation. Segregation of different components. It can be human body parts, it can be the metals, it can be plastics, it can be any other thing. So there are specific requirements for specific color-coded bins and also the bags, so that it can be maintained very carefully. And in India, you know that we started from 1989, and then it was revised in 2008, and then we have a very robust biomedical waste management rule which was released in 2016, and there are a number of amendments. And we have, in most of the states, we have biomedical waste management facilities and common facilities also. And in India, there are regulations for COVID waste management. So in that way, there are procedures like what to do and what not to do. Everything like how it has to be disinfected, and everything is very carefully and meticulously given as a guideline. And the facilities are supposed to maintain all those things. So some of the countermeasures, we have taken the framework for legislative requirements, then government support, facility enhancement. I'm very happy to announce that Government of India has very recently in June 2020 has opened a only COVID hospital which is having a bed of 10,000 under a single roof. So it is equivalent to 29 football ground. It is in Delhi. So capability enhancement, healthcare staff, and of course the financial use, huge financial support, because you know that in India the poverty is also a component with us. So in that way, government is giving free ration to the poor, other support, educational support. All these things are being taken care of by the government. It is very much necessary. On the other hand, we must be very careful about the emotional and scientific aspects, because those people who are handling the COVID-19 patient, the people who are handling the COVID-19 waste, you have to keep in mind that how their emotional feelings can be taken care of, how they can be encouraged for all this job. You know that COVID has affected such a way that all the goals of sustainable development has been affected by this COVID-19. So in that way, the specific goal which is very much intact with that, the climate action, life on land, life below water, and the responsible consumption and production. So these four are very much related, and you know that when there is a problem, there is always an opportunity to enhance the areas of concern. Like today, due to pandemic COVID-19, all the countries in India too, we are assessing the position where we are. We can understand that this type of situation handling is very tough if the facilities cannot be enhanced. So in that way, this is an opportunity, and the government of India is taking help, taking the scope of the opportunities to enhance the facilities through different state government. And there are countermeasures. I'm not going into the detail of this. So, but how the resource circle? The other part is India has a very good system of resource circulation, and if we look into this table, we'll find that there are data from many countries. I have just deleted the data of Nigeria because my Nigerian friends are here who can give better data than me. MSW generation, kg per day, collection efficiency, percent recycled, composted, energy recovery, others. So in fact, India is little better position than many other countries. Of course, if you don't consider the European countries and country like Japan and Korea, then India is enhancing its capability of handling the waste. So we have to look into that what way the recirculation process will go. So in that way, circular economy is one of the very important issue. And in 2016, when our 6 waste management rules was formulated, the 5R concept and the circular economy concept was just supporting these rules. So in that way, EPC to D, that means extraction, produce, consume, dispose, and depletion. So this model we are now discarding in India, and as a matter of fact, we are going to a closed loop system. We are shifting from here to the circular economy so that the resource consumption is reduced and the efficiency of resource consumption is increased by different material. And you know that whenever we talk about the circular economy, And whenever you talk about the recirculation of the material in the simpler way, if I use a material or the resources for a particular product, at the end of this life for a particular use, it should be usable and it should act as an input material to the second process. And in India, we are now trying to do this. For this, it is very important that it is not only, we have not to start from the product itself, but we have to start from the selection of the material, that is the design and concept stage. So this is one of my model where I have shown that we have to start the idea of implementation of recirculation of material or the circular economy from the concept and design stage and up to the disposal or the final sink. In this situation, the post-COVID situation, we have some advantage of this situation which has to be taken care of very seriously. The first is we have already started changing our behavior pattern. We are accessing over ownership, we are paying for the performance, and this type of service models we are now working on. We are now working on, you know that the export and import nowadays are nearly stopped or very slow. But on the other hand, we have to survive. So in that way, you would be very happy that our Honorable Prime Minister from the government has announced to be self-sufficient or self-reliant. That is called Swayam Nirbhar. So in that way, self-containment, self-sufficiency and local consumption, this is a very important issue for each of the countries. And I'm quite sure that India will be an example for the Swayam Nirbhar to be the self-sufficient by each of the countries throughout the world. The third is that the consumption pattern. Today, one is the short supply and the other is the capping consumption pattern. So these are all issues, because whenever it was not COVID situation, we always told that we have to reduce our consumption pattern, we have to change our consumption pattern. But due to this situation, we have already reduced our consumption pattern, we have already changed our consumption pattern. So taking the cue from this situation, we have to build our own system of recirculation and reduce consumption. This is also a model. I'm not going into the detail of it. I was telling about the rules. So India, these are the rules we have introduced in last for 2016, hazard and other material, construction and demolition waste, biomedical waste, electronic waste, plastic waste, and the solid waste management rules. So look, this is the situation still now we have in many of the places. But on the other hand, we are very happy that our Honorable Prime Minister and the government has created such awareness that this many people in many places are assembled together to take an oath that we will enhance the capability of our waste management, we will enhance the capability of our waste recirculation. And this was initiated in 2014, the Swachh Bharat mission, and today where we have reached, I'll just show you some of the glimpses. And the other thing which I'm very happy that we have already formulated a draft national resource efficiency policy, and this was in 2019. It is yet to be finalized, and we have taken a lot of targets in for this. So we have started this Swachh Sarvekshan under the Swachh Bharat mission from 2016, and now it is 2021. We are working for which we are working. In 2016, we included only 73 cities to have a very good waste management and resource circulation. 2017, that has been enhanced to 434 cities. And in that way, in 2019 or 2020, we could enhance the capability of 4,242 cities in the country. And the change in the strategies from physical progress, then output parameters, outcome governed, sustainability governed, institutionalizing Swachhata. Swachhata means cleanliness. And now for 2020, we are going for integrated approach of recirculation and waste management. You know, Indore is a city which has done excellent in these. This is also a competition, and where Indore has gained the first position in consecutive 3 competition. So we have tools and we have implementation accelerator. So 2020 and 2021, we have designed the whole system in 3. One is service level progress, one is certification, and other is citizens' voice. And you know that each of these are given some weightage. This is 40%, 30%, 30%. This is totally a third party. This is totally not related to the municipal person, but the citizens' voice. So in that way, each of these, I'm not going to the because these are all ranking with different percentages. So you know that whenever we talk about the first is the segregated collection, then processing and disposal, then sustainable situation, sustainable sanitation. So in that way, what is happening? We are, see, all these photographs are from different cities throughout India. And you know that these, the waste rack pickers, we have formalized them in the mainstream. This is all compost, the single-use plastic banning, the collection of the waste, and this is the cleaning of the public places. This is segregation of waste and the collection of waste. This is a collection and then transfer station for composting or any other thing. So in that, this is the safety of the people who are handling this waste. So the similar way, whenever we talk about the processing, these are all biogas plant, these are composting, this is also composting. So these are several processes, and you know that we are also encouraging the single composting at own house. So in that way, all these initiatives have some marks, and this is the way. But on the other hand, we have to see that what is the revenue income and what are the expenses. So in that way, government in one time was only service sector, and today government is also looking into that whether you are earning revenue or not. For many years together, it cannot be subsidized. But on the other hand, the landfill side, we are looking into the old landfill sites by remediation, and we are also taking materials from those things and recycling. Then the sanitation, the similar thing, we are also going for the FSTP and STP, the fecal sludge management system, sewage management system, septic system. Even in the public places, we are also enhancing, we are also seeing that how much is the cleanliness in the public toilet. So for each area, there are number of indicators where somewhere it is 7, somewhere it is 5, somewhere it is 2. So in that way, we are also looking into the what are the technologies the municipality or the cities, we have also prescribed in our rules that these are some of the technologies which you can take, and there are number of technologies, indigenous technologies which are available. These are the technologies which are also in place in many of the cities in our country. And you know, the other thing which is very important is for the plastic and e-waste management is the EPR, extended producer responsibility. And this extended producer responsibility is based on a business model. Very recently, we have already developed a EPR guideline, and it is under the process of finalization. And this is the scheme of EPR guideline in India. So there are PROs who will be responsible for collecting different wastes, electronic waste or plastic waste from the consumers and also from the users, and then they will go for the recycling either at the recycling factory or by their own. So this is a system which the government is very much careful for implementation. And of course, on the other hand, the COVID-19, there are some actions which are really needed along with the resource circulation. The awareness, commitment, and containment, legislative framework is very important. But most important is segregation of the waste, government support, safe and sustainable development, no recycling for the COVID waste, policy of economic development activities and continue and grow. And the last but the very important is resource circulation and utilize the scope of this opportunity at this moment. So with this, I'm once again requesting, many countries are here. So in that way, you know that India's Swachh Sarvekshan model is one of the very, very effective model which has been proved for last 5 years in India. And for many countries, this can be a pathfinder. And to enhance the resource efficiency in the cities, in industries, this is one of the very effective model. And always, whenever we are designing this year's model, we are taking the learning from other years' model. And today, in India, the database management is also very effective. So with this, I thank once again all of the organizers, participants, and speakers, panelists for making this webinar happen. Thank you very much once again.
Thank you, Professor Ghosh, for that presentation. You have really taken us through the generation of waste in this COVID-19 pandemic period. You have also showed us COVID-19 waste management model, how to go about managing the waste generated as a result of changing consumer pattern. Obviously, we all agree that our pattern of consumption has changed because of COVID-19 pandemic. Now, I would like to invite Mr. Ola Oresoya, a senior colleague and special advisor to the Ogun State Governor, that is Southwestern Nigeria, is the special advisor on environment, to kindly deliver his inaugural speech. But before then, I will request Dr. Sukrita to please introduce Mr. Ola Oresoya. Over to you, Dr. Sukrita.
Thank you. Thank you, Dr. Buraimoh. And it's a privilege to introduce Mr. Ola Oresoya, who is currently the special advisor to the Ogun State Government, Nigeria, on environment. He has been Managing Director and Chief Executive Officer, CEO of Lagos State Waste Management Authority, LASEPA, over 10 years. Mr. Oresoya was born in Ibadan. He got his bachelor's degree in geology from the foremost university of Nigeria, the University of Ibadan, and a master's degree in environmental management and ecology from the prestigious Obafemi Awolowo University, Ilorin, Nigeria. He is equally an alumni of Merseyside Polytechnic in Liverpool, United Kingdom, where he obtained a postgraduate diploma in business management. He is a part-time lecturer in waste management at the University of Agriculture, Obekuta. He is a profound waste management consultant and managing director at Globetech Remedial Limited. Mr. Ola Oresan, kindly unmute and deliver your inaugural speech.
Oh, thank you very much for the introduction. And ladies and gentlemen, I want to welcome you to this inaugural session of the India-Nigeria Connect webinar. Professor Ghosh, that was a very robust presentation and highly educative. I think mine is just a simple one, is a speech, and a speech to welcome us and whet your appetite for what you may have to see and hear during the discussion session. Well, I think the first thing that probably will attract you is that why Nigeria, India this time around, the collaboration. And I think the essence of the collaboration here, when you look at Nigeria and India, from even what Professor Ghosh just presented on that table that you saw there, you will have seen that the waste generation pattern between Nigeria and India are very similar. It's about 0.5 kilogram per person per day. And there are several other things that are very similar when you look at Nigeria and India, when you look at the demographic similarities between Nigeria and India, and that gives you an idea that the collaboration is quite very important. And I think we are all here today to listen and learn and exchange ideas. When you look at the population growth and the population density, which has a direct correlation with waste management, you see that similarity between India and Nigeria. Urbanization pattern is also very similar. You can see the cities and center of activities are within cities. And those cities are very similar when you look at India and Nigeria. Those are the kind of thing that attracted me when I saw the invitation. And when you look at economic growth, which has a direct correlation with waste management, I think, well, we may not have close relationship out there, but Nigeria has an aspiration, and the aspiration is to match India and look at the peer review. The economic growth plan for, according to the World Bank, for Nigeria this year is about 2.5% economic growth plan, and for India, I think India is about 6.2, and I'm sure Nigeria will be happy to match that or go beyond that. So when you look at the topic itself, the resource circulation and waste management under the pandemic, well, you look at waste in itself, if you look at it from the angle of a circular economy, just like Professor Ghosh just mentioned, waste management is a resource in transit, definitely. It's resource in transit, and it's got to do with what you do with that resource in transit, how you go about it with circulation of that resource and making it more useful. And that's the concept of the circular economy, as rightly entrenched there by Professor Ghosh. And what is this resource and the value chain, the business value chain within this resource that's in transit? You look at the storage business in itself, which is a packaging and storage. You look at the collection business, you look at the transportation, treatment and disposal systems within this value chain, and these are the key inputs there. And when you look at having the best of this resource, the input that will be probably required is, number one thing is knowledge, and I think knowledge is crucial. That is why we're starting this webinar coming from a professor from the university, and that the knowledge, what you have a knowledge about will enhance even the value that you add to the item. Then the structure, the knowledge comes from the universities and from institution of learning, and that's why the collaboration between, you will have seen the crop of presenters that will present today. You have people from the universities coming with knowledge and from research. You have people from government talking about the policy issues at government levels, which is very, very required right now. And you have a lot of people from the business angle that are going to discuss business opportunities. You have to transform this knowledge into business advantages. Then the human capital, which is very, very key in giving value to this knowledge, and the financial capacity, and the secondary application of whatever you are able to get from this. Well, when we look at from what Professor Ghosh just said, if you look at the consequence of the pandemic and waste management, you will have seen that there's a new normal now when we define waste management and from the new normal. The consequence from the pandemic, general consequence is one, loss of job. You have loss of job all over, which is a key thing. You have a wealth distribution and wealth redistribution. The wealth is now being redistributed all over, and you have the new normal, and you have cost-saving measures and lifestyle, and you have an increase in the use of electronic devices, and you have a lot of virtual transactions. A lot of things are now being done on the virtual transactions these days. And when we talk about the new normal now in waste management, for example, just like Prof just said, when you look at the waste bin now, the first thing that stares in the face right now, every waste bin from residential, in the time past, healthcare waste we differentiated as hazardous waste. But right now, every household residential waste bin is hazardous, because you already have people doing treatment of this virus treatment from homes. When you look at the typical waste bin right now, you see a lot of nylon and made up of biomedical packaging. You see a lot of pharmaceutical waste in there. You see a lot of syringes in a waste bin from homes now. So every residential waste bin right now should be classified as potential hazardous waste bin. So for typical waste managers, you have to put precautions into the compliance with the PPE. PPE, what you have been taking for granted before, you cannot take it for granted now. The use of PPE is very, very important right now. So every waste bin is a potential contaminant right now. Then also, when you look at the waste stream, the waste stream is changing right now. We are now having increase in electronic devices in your waste bin right now. A lot of people are now buying new electronic devices, modem are being used. You have a lot of batteries. So the content of your waste bin is changing rapidly. And these are issues we need to address. How do we move forward? Post-pandemic, during the pandemic and post-pandemic, what is going to be the new definition in waste management? We are going to have a new taxonomy, definitely, in waste management program right now. And a new taxonomy, new definitions of the content of the waste stream and the rest of it. One thing that is critical right now that is happening, from my experience visiting industries right now, industries are now going to cost-saving measures. Most industries are now selling their waste. And in the time past, you charge industries to pick up their waste. But right now, the reverse is the case. Industries are now looking to selling their waste. And selling their waste means that's a new definition, that's a new business process. There's a new business process that is going on. So the new normal has a lot of things that we need to look out for. And basically, to drive the new process in waste management, we're going to be looking at circular economy. And the engine for circular economy, just as mentioned by Professor Ghosh, is the EPR. Every nation must implement the EPR. Nigeria have started the implementation of the EPR. We already have 2 PROs for plastic and for e-waste, for tires, and for other ones, they are up and coming. So for plastic, you already have a body. The PRO is already in operation in Nigeria and running very well right now. For electronic waste, yes, it's also running right now. And we need to scale up those areas, and we may have to do a kind of an exchange with India and see how far India has gone in implementation of the EPR, so that Nigeria can take a leverage from there and see how it will be done. There are a lot of similarity, peculiarities, and our differences, our local differences. We're able to domesticate this knowledge from everyone. So, ladies and gentlemen, I know that we are all in here to learn and to learn from new knowledge and to learn the new policy. I'm sure those who are going to deliberate in the afternoon they're going to be deliberating on the new policy that is going to drive investment. And most of us who are here for investment purpose, I'm sure you're going to look at business opportunities in the new normal, in the new way to conduct businesses, in the new way to invest in waste management, both in waste management storage, in waste management collection, distribution, and disposal, and also recycling. So be attentive, be here to listen, be here to learn, because I'm here to enjoy myself and learn also. So I think I want to really welcome every one of us, and believing that the discussion session will pick up these new ideas and we'll deliberate on it, and we all have something to learn from this. So thank you all, and welcome to the webinar. Thank you.
Thank you. Thank you. Thank you.
Okay, sir. Thank you, Mr. Ola Oresonya, the Special Advisor to the State Government of Nigeria on Environment. He has been able to whet our appetite and giving us the similarities between Nigeria and India and what we are to expect from COVID-19 pandemic. Obviously, our lifestyle is going to change, and we need to actually manage our waste in a different manner, which is we have to manage our waste in a different manner as a result of COVID-19 pandemic. Once again, thank you for that presentation.
Thank you.
I now request Professor O.A. Lasode of University of Ilorin, Nigeria, and Dr. Payel Ghosh, an assistant professor, BDG College, to kindly conduct the technical session. The technical session is supposed to be from 11:45 a.m. to 12:35 p.m. West African time. So we are behind schedule, and now I'll mute my mic and then hand over to Professor Lasode. Over to you, Professor Lasode.
Thank you, Dr. Aremu. Good afternoon, participants and presenters. In this technical session, we have three eminent speakers: Dr. Olubunmi MOKUOLU, Mr. Sanjay Garg, and Professor David Olukanni. I now request my colleague, Dr. Ghosh, to introduce Dr. Olubunmi A. MOKUOLU.
Thank you, Professor Lasode, for giving me this opportunity. Dr. Olubunmi A. MOKUOLU is a lecturer in the Department of Water Resources and Environmental Engineering, Faculty of Engineering and Technology, University of Ilorin, Nigeria. Her recent work is in solid waste engineering and management, specifically working on waste to energy. She is a master trainer in medical waste management and has trained over 1,000 participants ranging from hospital cleaners to hospital consultants on same. Bringing in her engineering skill, she successfully designed a waste car for the waste handlers for on-site transportations of hospital waste, the place she worked as an assistant director. She has mentored several pupil engineers who are themselves at various levels of career development. Currently, she lectures both graduate and undergraduate students at the University of Ilorin. Dr. MOKUOLU obtained her PhD in civil engineering from University of Ibadan, Nigeria's premier university. Her bachelor engineering and master's engineering were obtained from the University of Ilorin. Her membership of professional associations includes the Nigerian Society of Engineers, Institution of Civil Engineers, Association of Professional Women Engineers,
and the American Society of Civil Engineers. She is a chartered engineer registered with the Council for the Regulation of Engineering in Nigeria. I now request Dr. MOKUOLU to present her lecture. To please unmute your microphone and share the screen. Next 15 minutes, the platform is yours, madam. Madam, please. Madam, kindly unmute your microphone.
Yes, I have muted, but please, I want to share my screen. Can you please allow me in?
Yes, madam. You can share your
All
screen now.
Yes. The inaugurators, the technical speakers, the panelists, coordinators and rapporteurs, the participants, ladies and gentlemen, my name is Dr. MOKUOLU, as I earlier introduced. I've been working on waste management for about 20 years out of my 30 years work life. And I have been I'm in 2 academics, passing my knowledge to both the undergraduate and postgraduate students. I'm here to speak on circular economy and waste management actions during COVID-19 pandemics, the Nigerian situation. Nigeria currently has an estimated population of about 200 million. It is made up of 36 federation states and operationally divided into 6 geopolitical zones. Currently classified as lower middle income country by the World Bank. Currently ranked as having the largest economy in Africa. Based on population and per capita generation rate of 0.5 kilogram per capita per day, the output of solid waste is over 35 million tons per annum. Models used to project future waste generation suggested that Nigeria will produce 54.8 million tons of solid waste by the year 2030. What we do with this huge amount of waste is essential. This is the map of Africa showing the location of Nigeria. This is Nigeria showing the 6 geopolitical zones. Now, solid waste management before the COVID-19 pandemic. Solid waste is disposed across Nigeria by transporting and discharging in open dumps. Generally at the outskirts of the city, where the nuisance level to human is minimal, are used as disposal sites. Poor and outdated waste management standards with no proper documentation of waste generation rates or the composition of the waste are the current situation. Inefficient methods of storage and collection. Municipal waste are disposed of together with toxic and hazardous waste. The waste are dumped indiscriminately and results in inefficient economy. This is a picture of outskirts and on the street dump sites. This was taken very, very recently. Now, presently, the open dump system are major threats to the aesthetics of the environment. And they also contribute and they also contaminate natural resources. This includes outbreaks of fires, pollution of rivers, and underground facilities by leachate and other health-related problems. It has contributed greatly to climate change through anaerobic decomposition, leading to methane emission, and greatly impacts the quality of life of its citizens. Nigeria has a growing concern for circular economy. Nigeria has a growing concern for circular economy resulting from various factors, including lack of legislative framework to control the incidence of unsound waste management practices and inadequacy of existing infrastructure to adequately manage the amount and types of waste generated, among other factors. The core problem of solid waste management in the country is attributable to, number one, the non-implementation of existing laws and regulations. Number two, need for the upgrade of obsolete legal instruments, inadequate budgetary provisions and funding mechanisms, poor monitoring and evaluation of as to guide the environmental safe and sound practices, solid waste management. In linear economy, products are exited as waste or destroyed. Whereas in circular economy, every waste is raw material for another. So we are now going to discuss about Nigeria and the circular economy. Nigeria practices circularity in certain aspects of life. These aspects include micro-level involvement in household waste reduction and reuse strategies, an informal market involving waste scavengers, merchants, and recyclers. Material recovery facilities are provided in some places to recover valuable resources from waste by local authorities or recyclers. Cases in point are the Waste to Wealth initiative set up by the government of some states such as Lagos, Ogun, Oyo, Ekiti, and Osun. These are states in Nigeria. Notwithstanding, circularity is not widespread in the country for a meaningful impact. These are pictures of segregated PET bottles and scavengers at work. We see them all over the states in Nigeria in operation. Now, waste management legislation was enacted in 2018 and released in 2019 to kickstart the operation of a structured circular economy. Compliance and enforcement of the policy paper was to follow the federal government of Nigeria's 5 Rs, a hierarchy for solid waste management, which are reduce, to repair, reuse, recycle, and also to recover. The policy includes protection of environmental standards, enforcement of regulations and legislation, compliance with international treaties and standards. The Nigeria Solid Waste Management Executive, Legislature, and Judiciary at the federal government at the Nigerian policy on solid waste management encompasses the executive, the legislature, and the judiciary at the federal, state, and local governments. The policy outlines the key sources of solid waste in Nigeria so that segregation, collection, transportation, storage, treatment, and disposal of waste are carried out in a manner that provides protection for the environment and human health and in compliance with legal requirements. The institutional framework within the legislature responsible for policy and regular matters on solid waste and the environment in general is the Senate Committee on the Environment and Ecology and the House Committee on the Environment at the federal level. Both committees play important roles that enact appropriate legislation that will foster successful implementation of the policy guidelines and also the action plans. Therefore, there is urgent to move into more circular economy by mainstreaming its principles and practices into local, state, and national roadmaps for sustainable transition from linear to circular economy. At this point in time, implementation is crucial. COVID-19 is a disease caused by a new stream. Well, this definition had been clearly made by Professor Ghosh during his presentation. I will just let us know that Nigeria is having her toll of the disease. All efforts towards containing the outbreak and spread of the coronavirus is directed towards establishing testing, isolation, and treatment centers or facilities. But systems for handling and safe disposal of infectious waste generated from the management of the disease are very weak. And we know that waste from COVID-19 facilities, we have those with symptoms or without symptoms. We have waste from quarantine units. We have waste from household and suspected patients. We have waste from other facilities with or without symptoms. And examples of waste that are collected at this center are face shields, face masks, disposable gowns, disposable gloves, sanitizer bottles, waste from laboratories, and so on. And this waste, majority have one-time use. Once they are used at once, they let go of them, and where they go next is a concern to us as waste engineers and managers. Now, this is a chart from MOKUOLU et al. 2015, and this chart was the outcome of medical waste generation of a tertiary hospital here in Nigeria. And from this chart, we have waste from various departments of the tertiary hospital. And from this chart, we noticed that majority of waste came from the children ward, from the theaters, and also from the antenatal or postnatal wards. And looking at the contents of the waste generated, we observed that majority are PPEs. If we look at that, those coming from the nursery and children, they are those majority are that constitutes the waste sum, while the disposable nappies or diapers. From the surgical wards, we have their gowns and the face masks and so on. So that suggests to us that in the wards or places where we use PPE, we are bound to have more waste being generated. So linking that to current COVID-19, we are bound to have more waste from our isolation centers, from places where the COVID-19 patients or those that are waiting to be tested and so on, where they are, we expect them to generate more waste. Other than the treatment to isolation centers, waste handlers have no manual to guide their COVID-19 related waste in the discharge of their duties. Guidelines and advisories, including travel and health workers, have been issued, but no management of municipal solid waste are arising from COVID-19 lockdown and restrictions. There is none also for COVID-19 waste that might have escaped necessary protocols from private hospitals for handling such waste. There are some private hospitals that have been designated to handle COVID-19 patients. So what happens to the waste that are being generated from these private hospitals is a cause for concern. Now we go straight to the management of COVID-19 waste. These are the expectations of solid waste managers and concerns concerning the COVID-19 waste being generated currently. Now, number one, segregation from source. Now, this is very crucial in medical waste management. Once you are able to segregate from the infectious waste from the non-infectious waste, then you make the route for treatment easier. And from reports that had been earlier generated, about 1/4 or 25% of waste that are being generated in the hospitals are the infectious waste. Others are not infectious, but that was before COVID-19. Now that we have COVID-19 with us, the amount of waste that is being generated in our medical centers, in our hospitals, especially places where COVID-19 patients are being managed, we're expected to have more than that 25% that had been earlier recorded. Now, the next step is adequate storage and transportation. Then safely dispose using appropriate technologies. And when we look at technologies, most of the medical waste are being managed through the process of autoclaving and also incineration. But however, we're talking about circular economy. How do we plan to make better use of the waste being generated from these centers at a time like this?
Excuse me, Dr. MOKUOLU. The time
Training
is
and
almost
retraining of
over.
workers on medical waste management shall also at this time.
Sorry for interruption, Dr. MOKUOLU. Your time is almost over.
Right,
Kindly finish your presentation.
I will soon round up, please. Now, this crucial question, the possibility of circular economy at this time. Now, this is a picture of a medical worker wearing that is a pictorial representation of material from highly infectious condition like COVID-19. You can see that these are steps to remove PPE. This was released by WHO, and we are looking at something like this being released in the management of COVID-19 waste for easy management of such category of waste. Something like this to be brought out for us, for everyone in the management of COVID-19 waste. It will make the work easier. Now, moving forward, there is need for implementation and enforcement of our 28th National Policy on Waste Management. At this time, implementation is very crucial and it is key. There is need for strategic communication to the community or to the population and punishment or fine for defaulters. Handling waste as raw materials for other innovations should be pursued, that is zero waste. There is a report that International Solid Waste Association is calling on government to treat waste management as an essential service, while public waste industry must be included in coronavirus emergency response, and member states must recognize waste as essential services. And finally, capacity building on medical waste management among workers from time to time. These are my references. I want to thank you all for your attention. Thank you. Over.
Thank you, Dr. MOKUOLU, for your excellent delivery. Please mute your microphone and share the screen. I now request my colleague, Engineer O.M. Ujowuro, Assistant Director, Lagos State Ministry of Transport, to kindly introduce the second speaker, Mr. Sanjay Garg, GM, BMW Ghaziabad Facility, Ramke Enviro Engineers Limited. Engineer Ujowuro, over to you.
Professor Lasude, if Ozouro is not present here, then you kindly introduce.
Hello.
Okay.
Mr. Garg.
Hello. Can you hear me?
Is it Mr.
Hello.
Garg?
Yes.
Okay, Mr. Ujowuro, please go ahead.
Mr. I am Sanjay Garg. Can you hear me?
Yeah, we can
Okay,
hear, but let him
I want
introduce
to
first.
introduce you. Okay.
You can put your slide. Carry on.
Okay, Mr. Sanjay Garg is the project head, Ghaziabad Biomedical Waste Management Facility, Ramke Enviro Engineers Limited, having vast experience of 35 plus years, while he served numerous prestigious organizations in diverse roles, including Director, Finance and Administration, in charge of Operation and MBD, GM operations, among others. He worked on industrial efficient quality enhancement and installed air pollution control systems, ETP, STP, in sugar mills, open cast coal mines, and many others. Since 2003, he had been an active part of the growth of Ramke Group in India and contributed in designing and establishment of the country's first common biomedical waste management facility in Ghaziabad, and subsequently pioneered 8 such facilities around the country. He significantly contributed in various public policy meetings and helped in formulating policy papers for statutory bodies. His expertise includes site selection, environmental clearance, finalization of pertinent machinery, operation and maintenance. Mr. Garg, you have 15 minutes.
Hello. Good afternoon, everybody. Hello.
Yes, please go ahead. Put your microphone on and camera on.
Yes, camera is also on.
And share your PPT. Ipshita, why you are not intervening? Ask him to share his PPT. How?
Yes, sir.
I'm sharing.
Please share your
Yes.
screen. Yeah. You are presenter and
Yes.
you just share the screen.
I think you can see now screen, my presentation. I'm Sanjay Garg from Ramke Enviro Engineers Limited. This company is leading in the waste management and all fields like e-waste management, municipal solid waste management, industrial waste management, biomedical waste management, all these fields. Here, I am going to present the things regarding biomedical waste management plant, how the India is managing biomedical waste management by 1998. This company, Medicare, is a part of specifically designed for this biomedical waste management. This is having the approach for cradle to grave. India's largest biomedical waste management firm. It started in April 2017. Biomedical waste management facilities are already commissioned, and this company is serving to 30,000 healthcare establishments, and this company having 1,100 professionals across India. This is the project or plants established. Who are on the risk of the biomedical waste management? This is doctors, paramedic staff, ward boys, sweepers, municipal workers, patients, attendants, and public at large. Biomedical waste will impact on environment, air, water, soil, human health also, and occupational rag pickers. This was the situation before 1998 when biomedical waste was not managing. In India, government has made the rules in 1998. After 16-year experience, they revamped the complete biomedical waste rules and incorporated lot of experience of the facility operator and waste management. In this regard, they made some guidelines also how to run the incinerator, how to control the waste transportation, and CBWTF, common biomedical waste treatment facilities, need to establish what are the infrastructure required for any waste management facility. Environment clearance is also made compulsory. Biomedical waste management has some specific steps which start from the waste segregation that should be done into the four categories, that is incinerable waste, autoclave waste, sharp waste, and third one is glass waste. So it's necessary to segregate at the source. It is not possible to segregate at the facility. Collection and transportation is the next step in case of biomedical waste management. It should be carefully transferred from ward to ward collection within the hospital. There should be a single point of collection from where a facilitator of common biomedical waste facility will collect the waste. The collection point should be prepared with the discussion between facilitator and the facility. The transportation of the waste should be in closed container vehicles, and it should be environmentally safe, completely in color coded bags that should be in bins and closed container vehicles. I am showing some pictures of this waste transport system from CBMWTF. These are our vehicles. You can see that how we are transporting the waste safely. We have implemented the global positioning system also, from where we have collected the waste and by which route it is coming to the facility, or complete waste is reaching to the facility or not. To control this, we implemented the barcoding system, QR code system, how much quantity of the waste is collected from the hospital and how much waste is reached to the site, and it is completely handled by the facility or not. This is a small layout of the facility which we are making across India, that is having a separate storage room for the treated, untreated waste, admin, ETP, incineration shed, workshop, storage area, DG set, all this. This is a typical layout of the CBMWTF. This small process chart, you can see that there is a collection transportation by these vehicles. These can be the four types of the waste. Mainly treatment is of two types. One is autoclave, second is incineration. In case of the autoclave, it should be after autoclave shredded into the through shredder, and this will go to the recycler, or some metallic part can go to the landfill also. In case of the incineration, this will go to the incinerator and it should be equipped with the air pollution control system completely. The pollution board has decided the norms, emission norms, and that should be followed. You can see some pictures of the incinerator. This is through conveyor belt. There should be a primary, secondary chamber. Temperature is fixed 850 plus minus. In secondary, there should be 1050 degree. This is the pictures of autoclave. These needle cutters which should be used in the hospital. These are the ETP and air pollution control system. The shredder. The norms are fixed. Particulate matter should be 50 and NO2 400, HCl 50, dioxin, furan, mercury. The guidelines is prepared when the COVID-19 pandemic is started. There was a big problem that waste quantity was completely increased in each hospital, minimum 3 times, or maximum portion was the plastic waste. For this purpose, Central Pollution Control Board of India called the meeting immediately and issued the guidelines initially in the 16th March and revised that 3 to 4 times because the quantity of waste was very much high and it was very much difficult to handle the waste. So it is issued that all bags should be double layered. It should be properly disinfected. Completely staff should be trained. All vehicles 2 times it should be desanitized. Maintain proper records of the COVID waste. Dedicated trolleys and all containers, bins, trolleys should be disinfected with sodium hypochlorite. Also mentioned that implemented the application to record the quantity of the waste. In this application, every generator should feed the quantity of the waste. That quantity was supposed to accept by the transporter, then it should reach to the biomedical waste facility. And at the time of disposal, it should be matched with the quantity of the waste which is collected, that is completely disposed. This was the important point. There should not be any leakage. So regular sanitization of vehicles at the facility, separate vehicle for COVID waste specifically, and COVID waste should be disposed of immediately upon receipt at facility. We cannot store this COVID waste. We should use this all PPEs and its application is mentioned here. I am going to give some pictures of our plant which are across India. This is ETP. This is shredded waste after sterilization. This is landfill. These are some facilities of different cities. Thank you very much. Hello.
Professor Lasode.
And given practical wishes.
Carry on, carry on.
Kindly mute your microphone and share the screen. Kindly mute your microphone and unshare the screen. I request Dr.
Yeah. Hello.
Badia.
Please carry on, Rahul.
Yes. Yeah. Thank you, Professor Lasade. So I would like to introduce Professor David Olukanni, who had his
But ask
PhD
Mr.
degree in.
Excuse me. Ask Mr.
Yeah.
Garg to unshare. He is still in
Yes.
the.
Mr.
Yeah.
Garg, can you
Carry on.
unshare? Yes, already.
Carry on.
So yeah. Professor David Olukanni had his PhD degree in civil engineering with special interest in environmental engineering. He is a Fulbright Fellow to the United States, where he studied at the University of Oklahoma, Norman, and researched at North Carolina State University, USA. He works on WSCA and INVEST projects with the Faculty of Applied Science and Engineering, University of Toronto, Canada. He has won several awards and grants for research and travel scholarship to international conferences abroad on water and environmental related issues. He is a registered member of Learned and Professional Association and has over 17 years of academia and industry experience. He has participated in many civil engineering projects and has published over 150 articles in book chapters, proceedings, and journals. He served as the head of civil engineering departments, director of quality assurance and standards of Covenant University. He is a visiting scholar to the Civil Construction and Environmental Engineering Department at North Carolina State University. He serves on the editorial board and also as a reviewer for many journals. He also consults for industries and companies on waste management related issues. He serves as assessors and external examiner for postgraduate dissertations and theses in many universities. His current area of research includes waste management and its application, wastewater treatment system, water sanitization and hygiene, WASH programs, rural and urban sanitization and hygiene studies, water supply in rural and urban communities. He is the host of the Blessed Life International Christian Center, a non-for-profit organization. He teaches courses in civil engineering, water resources, and environmental engineering, and has supervised and mentored several students towards the award of their various degrees. He has keen interest in engineering education with a strong passion for sustainability. He is the cluster head urban environmental issues and national development at Covenant University. I will request him to kindly unmute and share your screen. You are ready. I think you will be able to present now. Yeah. I think you are not audible, sir.
Yeah, thank you very much for the citation. That is well appreciated. First and foremost, I want to appreciate the Almighty God for this opportunity to making this program happen. I also want to appreciate all the organizers of the conference or the webinar, starting from Professor Ghosh, Dr. Buraimoh, and every other person who has been part of this. I also want to appreciate our distinguished leaders from the academia, from the industry, and much more also from the government. And also, I do appreciate the presence also of some of our traditional, leaders who are also here to drive even this project at regional, levels. Once again, I welcome each and every one of us, and also appreciating all of our students, even from this university, who are present. The title of this presentation is just Waste Management under Pandemic COVID, which just put it to say the impact, the implication, and what way can we go in solving our problems. I have this content here to talk about the introduction. I also talk about the SDG goals and the population statistics. I have the...
Excuse me, sir. Excuse me, sir. Sorry to interrupt. Sir, can you make it a full screen?
Yeah, 1 second.
Yeah. Yeah.
1 second, please.
Just bottom. Yeah. Either from slideshow or from bottom you can.
Yeah.
Yeah.
Beautiful.
From the beginning.
Yeah, thank you.
From the beginning. Yeah.
So the title, like I said, is Waste Management under Pandemic COVID-19 in Nigeria, Impact, Implication, and the Way Forward. And you can see the connect, Indian flag and Nigeria. We are into this all together. My presentation is just having a few contents, the introduction through to the current challenges, the questions that come to mind, what is the impact and implication, then the solution, conclusion, and recommendation. We are all familiar with this. This is the challenges that poses, a kind of issues, to all environmental engineers and waste managers. You can see the role of government. They've tried so much. In most places, there are no landfills. What we see is dump sites, challenging with scavengers, people just trying to find their way. And that is just something to look at. With all of those challenges, we'll also see that the governments of nations, about 173 of them who came together in 2015 to come up with solutions that will come even by the 2030, talking about the Sustainable Development Goals. And the question that comes to mind is that how are these goals affecting even the situation that we are talking about? You will see, for me, as highlighted here, we have about 7 of them that actually has a pointer, to the COVID-19 situation. Talking about good health and well-being, talking about clean water and sanitation. You talk about affordable clean energy. You want to talk about climate change. You want to talk about life below water, and also even peace and justice, or life on land. I have this screen also shared with us. You will realize with me, I've just picked a sample to say the 10 top countries in the world. And I look at the scenario for 2015, the 2020, where we are in currently, what is going to happen in 2050 and in 2100. You will see with me that currently Nigeria and India has some close relation. And by the time we get to 2100, you will see that at that time, India will be #1 most populous, nation in the world, while Nigeria will be #3. So it's a good step in the right direction with what we have here. And also talking about the solutions to bringing in place what SDG goals. I also put up a graph here to also give an idea of where we are. You will see India has picked up again, while United States is kind of coming down the cliff of that. Why we have that data for Nigeria and some other countries, because the testing and the record that we have, they are not at par. So if we also have equal testing, so to say, in Nigeria, perhaps we'll be able to see something much more than what we have. I also put clearly here the COVID-19 status of Nigeria and India. You will see where India is, and you will see what Nigeria is. It is good to situate at this point in time as the reference here to say in the year 2100, even if Nigeria is going to be the 3rd most populous nation in the world, I'm happy to tell us that Lagos, Nigeria, would be #1 most populous city in the entire world. So that means 88 million populations will be in Lagos. So what are the measures that we are putting in place as a nation, and what way are we going to solve the problem of waste management? You can see all other cities as they talk down the line. This is the current statistics of COVID-19 cases, and I've put them as we got them from the NCDC. That's the National Center for Disease and Control in Nigeria. And you can see the total confirmed date as of yesterday, 10th of August. And you can see the number of deaths that we have. Like I said, we are here in Ogun State, Nigeria, and we share boundaries with Lagos State. So I just, in the next slide, picked a situation where it's only Lagos and Ogun that I'm just trying to situate a few points. But the current challenges that actually pose a threat to waste management are the things I have highlighted. And I want to appreciate all the previous speakers who have also mentioned 1 or 2 things. The challenge that this poses to us is what quantity, what are the availability of workers that we have for collection and disposal of our waste. We generally have now, whereby waste are commingled even together with the COVID-19 waste. Another challenge is collecting waste from homes of individuals who would not go to isolation centers, because we know some persons in the nation who perhaps prefer to just be within the confines of their home and not really going to isolation centers. So how do we deal with that waste? Then what is the capacity of Nigerian centers? Start for COVID-19 waste. Then what are the informal workers? What is the situation and what is the safety that has been put in place for them, and how do we change behavior? This is the impact. This is the impact of COVID-19 waste. Please, I'm having a background discussion. Please, background let me correct that background interference. Please let me mute Professor Ghosh. According to the data from Nigeria Center for Disease Control, NCDC, we have that population, as I've said. Poor waste management of contaminated PPEs may increase the spread of viral disease. Microplastic and medical waste and pharmaceuticals are also getting to our waterways, and improper disposal or disposal of plastic waste and used bottles. Also, I think that this we have about also the impact is disposed to used bottles are often collected and reused to package locally made drinks and herbal medicines that are sold across the country. Another danger. Low collection coverage and irregular collection services has pushed most households to rely on scavengers for the collection and disposal of their waste. So in some cases, the waste is not properly, handled, and scavengers are, many of them, put at risk. So where or what is the source of this waste? And I've put them to say the isolation centers, the quarantine facilities that we have, the healthcare facilities, and the COVID-19 testing centers. So the questions now that come to mind for each of all of us to go and think about and also put a measure to be in place is how many healthcare facilities and isolation centers that we have. How many? We have to get that statistics. How can we ensure a scientific way of managing our waste? Not just noting them on paper, not just noting them on policies, but how do we take them, bearing in mind the collaboration between the industry, the academia, and the role of the government? How do we avoid contamination in the process of waste handling? What mechanism is in place to handle waste during this period? And how do we preserve the rate of efficiency, if at all we get anyone, even for the post-COVID-19? And what do we have in mind by 2050, when the population or the quantity or the waste generation at that point will be about 3.4 billion tons, as against the 12.1 we have? Just let us note that by 2015, we have 70% increase as of that time. Let's begin to think about the solution. I have this chart here, very, very instrumental. We have the functional elements in waste management for integrated waste management for smart city, and we have the critical elements. What is very critical at this point is the processing and also the disposal. We know generation, we cannot do so much about it. It's a functional element. The storage as well have their own issues, but the key place is going to be the processing and the disposal. If we're able to do that processing and disposal very well, I think we can be able to tap some recovery or some resource even from the waste that we have generated in terms of gas, in terms of fuel, in terms of electricity, depending on the expertise of respective persons who are part of this. I put this picture here as a measure we have put in place. We came up with an initiative in 2014, initiated by me and a colleague, on managing waste even in our university. And you will see what we practice currently at Covenant University. You can see the food waste colored green, the paper waste red, and the blue for paper, for recyclables like plastic and PET bottles. This is what is operational in the university currently, and I'll speak to that in a short while. And you can see the facility we put in place. You can see the truck by the magnanimity of the university to put a truck to actually collect all of those waste. And this is what the program was inaugurated. And you can see me also while we are processing and also creating opportunities, for persons who are working and bagging the waste when they are crushed. And we can see as way of segregating those waste, that which is for organic, we are also able to apply them in the university farm. So that is a solution before the pandemic situation. But what is going to be the current solution as we move on? Segregation will be the way as well too, because we can do the same for waste during this COVID. And we can see from other presenters who have highlighted the type of waste that we generate, the color coding that we can also propose, and the treatment disposal, which many of my earlier presenters have made some comments. And if we go by this way, I think we also can, harness resource even from the waste that we generate, even in COVID-19. However, we did a SWOT analysis of the waste management sector in Nigeria during the COVID pandemic situation. You can see the strength, which is very key. SWOT analysis is very, very important. What is the role of private sector in solid waste management? And what are the waste composition? Then the weakness is the weak policy and legislation and enforcement, institutional capacity, and lack of political will. But the opportunities that comes with all of this is the increasing stakeholder participation in waste management, sustainable waste management, and employment opportunities, as we have seen in the slide I present much more earlier. What is going on? 1 second, please. Something just pushed off that. Yeah. So if we also want to come up with a solution now, then the next thing is to think of policy versus practice. I've shared with us Covenant University experience. Then we have to change our policies. That is, better practice will influence policies. That is, practice to policy. We have worked so much on doing with the policy and taking it to practice, but I can tell us at this point that if we deal with some policies practices at our local level and we see good results with that, then we can take to the assembly, that's the legislature, and to say this is working here and we can adopt it. And this can be shared with relevant organizations and countries as well. Effective practice at the local levels influences decision by the policymakers, and other cities can replicate and adopt better practices. And we have to identify that there are different responses to COVID-19 by each country. We have to bear that in mind. The way India will respond to COVID-19 perhaps might be different from the way Nigeria will respond, the way US will respond differs. So we have to understand that identity of each nation or each locality, so that that practice that we are bringing in place can be actually transmitted or transcribed to other places. So solution today may not be sufficient for tomorrow. We also have to bear that in mind, because all of these things are evolving. So speaking now in the light of solutions, poor waste management practices is not limited to lack of policy or laws. We just have to bear that in mind. And good infrastructure, education, social awareness, and strong institutions to promote sustainable environmental actions must be in place. There is need to strengthen biomedical waste management in most of our districts and all across our nation. And there is also need to create awareness on safe disposal of our PPEs. And we also remember that problem comes when we refuse even to apply, the rules, because it's one thing to know, it's another thing to do. So what have developed nations done to manage their waste? Simply, they have invested in effective waste management. So if we also are doing this from the government level, from the academia, and from the industry, that collaboration, then we are good to go. You can see, if we have that in place, you can see the neat, clean city, you can see resource being taken, entire way of circular economy or cycling, which also those things can be used for other places. And you can see the truck also, if it's in place, can go and pick and collect all of the waste. This is just a few things that I've brought on board for us to just think about. And just remember also that effective waste management begins first with you. Thank you for listening and for your attention.
Thank you, Professor Olukanni, for presenting the situation in Nigeria. Kindly mute your microphone and unshare the screen. I now request the speakers to address the questions, and may I request the rapporteurs and coordinators to raise the questions from the chat box. Each speaker should at least address one problem.
Okay. Good afternoon.
We expect our questions, participants. Where you have a question, please put it in the chat box, and we will then address your question. While we await the questions, I want to sincerely thank the speakers for their valuable speeches and the queries that they will eventually attend to. And then we can start the panel discussion as soon as the questions are addressed.
Okay, we have a question, sir. Professor Lasode.
Yeah.
We have a question for Dr. Olubunmi MOKUOLU. The question goes thus from Frita. What are the parameters to be followed in the post-COVID-19 period in regards to radioactive wastes? Let me just come again. What are the parameters to be followed in the post-COVID-19 period in regards to radioactive wastes, by Ms. Preetha Banerjee? This question is for Dr. Olubunmi MOKUOLU. Thank you.
Hello?
Okay, hello, ma.
Are you hearing me?
Yes, we can hear you, ma.
We can hear you.
Thank you. Yes, if I understand what the question is, the parameters to be followed in post-COVID-19
period
regarding radioactive waste.
Yes, ma'am.
Yes. So the radioactive waste are waste categorized as hazardous waste, and such waste needs to be handled with care and with people that had been trained in the management of such waste. And currently, the radioactive waste, most of them end up in the oceans. And there should be way of handling such waste economically in such a way that it will be useful even after the end of its life. So recycling such waste is actually the best way. But currently, to my knowledge, it's ending up in the sea and the oceans. Thank you.
Can I add to it?
Okay, sir.
Yeah. This is my response is to the person who raised the question, because you know that here we are not experts on this issue. So in that way, you know that there are rules in every country for handling this type of waste, and it's better always to look into that particular guideline and the regulation in that particular country. And as MOKUOLU is saying, it's not in general that it is going to the ocean. At least in India, it is not happening. And there are many other countries where it is not at all happening. So in that way, no point of commenting on that. Better, you please go through the rules and regulation of a specific country which you are concerned and look into it, because this will be better for you. We are not here experts on that particular area. Thank you.
Okay. Thank you, Dr. MOKUOLU and Professor Ghosh. We also have another question, and I think any of the panelists, any of the guest speakers can answer this. The question goes thus: what strategies, policies, and legal framework can we put in place for effective management of waste in Nigeria and India? Okay. Can we have Mr. Sanjay Garg to answer the question? Hello?
Yes, Mr. Sanjay Garg, can you please answer the question? Are you here, Mr. Garg? Yusuf, I think you can pass on the question to any of the panelists. Mr. Garg doesn't
Okay,
seem to be responding.
Can we have Dr. David Olukanni to answer the question, sir? Okay.
Hello?
Hear me? Can you hear
Yes,
me?
we can hear you, sir. Yes, sir.
Very good. Yeah. What I'm saying is that if I understand the questions very well, the person who asks is saying that what measures can be put in place for both countries, right? To solving the
Yes,
problem.
exactly.
Yeah, that's
Yes,
what I have
frame.
presented. Very good. I presented that in the last, towards the last slides of my presentation. You know, we have towed the line of policy, then to practice. Are there indigenous solutions at local levels that persons can think of so that if a particular approach works in a place, then that could also, because I can tell you it is people from the industry and actually the academia that can advise the policymaker. It's what put together that becomes a document which could be like a framework of what should be adopted. So why not let's try from the place of practice, and in the place of practice there must be concerted efforts also by the government to give support in the place of providing infrastructure, support in the place of actually educating people, support in the place of awareness and strong institution in place so that there will be a sustainability of such approach. So when that approach is taken, I think we will really go a long way. So that means it is actually driven by the people. That means from the bottom even to the top, and everybody will embrace that than only a policy coming from the top and people don't even have a clear understanding of that. So if we toe that line, I think we'll be good to go. Thank you very much.
Thank you, Dr. David Olukanni. Another question for you before you leave.
If I may add to that,
okay,
please. There is a policy on solid waste management in Nigeria that was released in 2018. And part of my presentation spoke on that we need to implement. Implementation is key at this time. And secondly, support with funds. And in order to make this work, we need to communicate also to the population. We need to let people know the problem that arises from mismanagement of solid waste, especially health-wise. And this communication combined with implementation and support with funds will go a long way to move us forward. Thank you.
Thank you very much, Dr. MOKUOLU. That's very nice answer from there. And so we'll be back to Dr. David Olukanni on the question. That is, the question goes thus: the data shared as regards the population explosion in Nigeria and Africa appears very frightening. I don't know if there are plans to share the documents with policymakers in Nigeria for effective planning and possibly institute a mitigation strategy. This is from David Adu.
Yeah, thank you very much. If I want to attempt to answer that question, these are statistics by the World Population Prospects. I have the source even of that data, and this is actually by United Nations Population Division. You see, we have to also have an understanding of the projection since the time the SDG goals were set out. And we have to also project to say in the years to come, how are we able to tackle this? So if you remember on the slide, I showed to us what the ranking of India will be at that point in time. India will be #1 in the world in terms of population. and Nigeria will be number 3. So China will just be in between, and these are going to be the world most populous nation. So it's just to give us an idea of how we should think ahead in solving, the waste management issue. The slides can be shared at the end of the day, but at least the source of the information, if you Google that, United Nations Population Division, it's recent data, and we have much more even than the 10. I just picked the most top 10 to be able to drive home or situate, our context, basically. And even for Nigeria also in 2100, like I said, Lagos is going to be the most populous. This is just, when you look from behind where we are now, you can also project to the future. So that is what stands in front of us, and we all have to prepare for this. Thank you very much.
Okay, thank you very much, sir. But before you leave, another question as regards Covenant University. Someone likes to know what ways can we translate Covenant University's approach to global way of waste management for circular economy and sustainable development. This question is from Oludari Joshua Oyebode.
Thank you very much for that beautiful question as well. We looked at, if you remember very well, before 2015, we have the MDG goals. And believe you me, from the developing parts of the world, we were unable to meet those goals. If every one of us, we want to pitch a tent in that regard. So we were thinking as a university, it's a campus that has a lot of, in terms of student population, and we generate huge amounts of waste. So what do we do as waste managers? So the idea of desegregation comes into play. And at this point, I want to say the involvement in terms of the fund that the university, the proprietor base, put into this was humongous. And I shared also in the screen what we do currently with that waste. We have partners now, even with industries, where all our paper and disposable waste are turned into usable products. For us in the university now, we don't buy tissue paper, we don't buy serviettes. All of this paper are turned into waste. For all our PET bottles, we process them. We have partnership with also companies who buy all of those. And even now, we build them for them even to process by themselves. And a huge income comes to the university. On the platform of the food waste as well, in organic waste, we also compost that and use in our farm. So this is doable with any other institution. And if we take this practice across institutions globally, this also will flow even to our various homes, to our various cities. And before we know it, everywhere is tidied up. However, we must bear in mind now, COVID has come into play, and there might be a need to recalibrate in terms of the kinds of being we want to put in place and actually educating people. Thank you very much.
Okay, thank you very much, Prof. That has been a very insightful one. So I would like to leave the microphone for.
Yeah, I want to sincerely thank the speakers for their valuable speeches and answering the questions of our patient participants in such an informative manner. More questions will be answered during the panel discussion. Now we will start the panel discussion, and I invite Professor Sadhan Ghosh to kindly share the panel discussion. Kindly unmute on your microphone and start the session, sir.
Yeah. Me? Can you hear me?
Yes.
Yes, sir. But voice.
All right.
But equal is there.
Thank you, Professor Lasode. Thank you, Professor Lasode and the speakers. So now it is the time to go for panel discussion. We have 6 distinguished panelists in this program. So I request our team to please introduce one by one the panelists, and whenever I'll request the panelists to be introduced, kindly put on your camera so that we can see the panelists. Please go ahead. Ozouro is not here, so instead of Ozouro, I request Ifshita to go ahead.
I am here. I am here.
Oh, you are here, Ozo.
I'm here.
So please go ahead.
All right.
As per our program, please go ahead. You introduce Dr. Adedolapo Fasawe.
Thank you. Dr. Adedolapo Fasawe is the General Manager and Chief Executive Officer of Lagos State Environmental Protection Agency, where she is responsible for implementation of policies aimed at protecting and improving the environment in Lagos. Prior to her current appointment, Dr. Fasawe served as the coordinator of the state's special health programs, where she pioneered and coordinated the Eco-Free Health Mission, serving across all local governments in Lagos State. She was also the pioneer desk officer for mental health programs, facilitating the promulgation of the mental health bill for the Lagos State, which was passed into law in January 2019. As the general manager of LASEPA, Dr. Fasawe has driven a number of environmental and sustainability projects with success, including the Noiseless Lagos campaign and ban of single-use plastic bags campaign. She is a member of several national committees, including the National Committee on the Study on Available Sustainable Alternative Materials to Plastics and Innovative Packaging and Recycling Technologies, sponsored by the United Nations Industrial Development Organization, UNIDO. She is considered as one of the foremost experts in Nigeria on understanding the nexus between public health and environment for building resilient urban areas. Dr. Fasawe received her MD CHB degree in medicine and surgery from Obafemi Awolowo University, Ile-Ife, on honors roll. She was also adjudged the House Officer of the Year at the end of the housemanship at the same university. Dr. Fasawe holds a master's degree in public health from the Lagos State University College of Medicine, diplomas in international health consultancy from the Liverpool School of Tropical Medicine, and global mental health management from King's College London. Ladies and gentlemen, I introduce to you Dr. Adedolapo Fasawe.
Thank you. Thank you. I request Dr. Sutripta Sarkar to introduce Ms.Sanchita Jindal. Sutripta?
Yes, I'm here. Ms.Sanchita Jindal served advisor, scientist G, Government of India, as having 35 years experience in the field of environment conservation, was involved in notifying almost all rules on hazardous chemicals and waste. She was the member secretary of expert group constituted for finalizing all these rules. She was the first one to introduce EPR in battery management rules on e-waste and plastic waste. She was instrumental in introducing the concept of resource recovery and circular economy, EPR co-processing, and waste to energy, zero landfills. Polluter pays principal decentralization waste treatment, 6 Rs, and many more into the waste management rule. She has been member of more than 60 committees of various ministries, including 8 committees constituted by NTT, National Tribunal Management. She is consultant to Industries for Waste Management and EIA. Ms. Sanchita Jindal. Our next panelist is Dr. Olunike M. Buraimoh, lecturer, University of Lagos, Nigeria. Engineer Yusuf, can you please kindly introduce him?
Thank you very much. Dr. Olanike Maria Buraimoh. She's a lecturer and a researcher from the Faculty of Science, Department of Microbiology, University of Lagos, Akoka. She had a BSc, MSc, and PhD in microbiology from the University of Lagos, Akoka, Lagos, Nigeria. She's an established academic and researcher, an administrator, a mentor, and an entrepreneur in the making. She has been a visiting researcher doing a postdoc at the Institute of Process Engineering in Life Science in Karlsruhe, Germany, and also a visiting scholar at Ohio Agricultural Research Development Center. He has research interests in environmental microbiology and biotechnology, special focus on bioremediation of polluted ecosystems. He has received several grants and fundings, such as the TED Fund research grants, and so many other ones. He equally has been a member of several professional associations, namely Organization for Women in Science for Developing World. She's equally a fellow of the Institute of Policy Management Development, Nigeria, a member of the Nigerian Society of Microbiology, a member of Society for Environmental Toxicology and Pollution Mitigation, and of course, a member of the Institute of Public Analysts of Nigeria. May I have the pleasure to introduce to you once again, Dr. Olanike Maria Buraimoh. Thank you. So I think we'll have to the next person to be
Our next
introduced.
panel, Dr.
I request all of you to please mute your microphone. Please mute your microphone. Kindly mute your microphone who are not. Kindly mute your microphone. Yeah. Dr. Chanakya, possibly he is not there.
Is okay. I request again Engineer Yusuf Majolagbe to introduce Dr. Suneel Pandey, who is the director, TERI India.
Okay. Yes. Dr. Sunil Pandey, Director, TERA India, is the Director of Environment and Waste Management Division, leading research on pollution control and waste management, and adjunct Faculty of Energy and Environmental Department at the Energy and Resource Institute, TERA. He has 30 years of research and consultancy experience on industrial wastewater, e-waste, MWS healthcare waste, and industrial hazardous wastes. He has experience on performance assessments, environmental monitoring, and environmental impact assessments in different industrial environments. He has been member of expert group at Humble Supreme Court Committee, Department of Science and Technology, Ministry of Environment, Forest and Climate Change, Central Pollution Control Board, Ministry of New and Renewable Energy, and Kolkata Municipal Development Authority and Pune Municipal Corporation on issues dealing with waste management. He has authored, to his credit, more than 20 research articles and guided PhD and master's thesis, over the years. So I have the pleasure to introduce to you, the Dr. Sunil Pandey. Thank you.
Thank you. I now request Sutripta to introduce Professor Arutchelvam. Arutchelvam is there. Let us first check whether he is there or not. Arutchelvam. Professor Arutchelvam is there or not? Possibly he is not there. So let us skip his introduction. Now let us introduce Professor Onipede Wusu. Are you there, Professor Wusu?
Professor Wusu, are you there?
Wusu is there or not?
I have not. I'm still trying to check.
Yeah.
I don't think
Please
he's
just call her
on.
if she's there. Yeah, because I could not see her.
Yeah.
So in that way, yeah, I am quite sure that Professor Dr. Chanakya is not here. And once again, I'll just check whether Professor Arutchelvam is there or not. Arutchelvam. So in that way, presently we have with us Dr. Fasawe. It is better always to see your face, and if you kindly put on your microphone, then it will, sorry, put on your camera, then it will be easier for me to identify. So Dr. Fasawe, Ms.Sanchita Jindal, and Dr. Olanike is here or not? Maria? Because I could not see her, I mean.
Olanike is here.
Yeah, can you put on your camera?
It's not
Please
working.
Very good. Okay.
It's not working.
All right, Dr. Sunil Pandey is here. So we have 4 panelists in this evening. So let us start our discussion. And I request all the panelists and also other participants to please mute your microphone. Once I request, then only you unmute and speak, and again mute. You know that our main concern in this webinar is the resource circulation and waste management under this COVID-19. And we know that resource circulation is one of the very important issue for all the countries throughout the world at this stage. And moreover, when during the COVID-19 pandemic, we have already reduced our consumption level by force of course. So in that way, I request all the panelists to speak on this resource circulation initiatives in your country for say 2 to 3 minutes. Now we will switch over to other subjects. So in that way, let us concentrate on our timing and also specific subject. So if we start with Dr. Pandey, Sunil Pandey, because you have already done so much of work on resource circulation and resource efficiency. Please.
Thank you, Professor Ghosh, and I hope everyone can hear me.
Sure.
As mentioned in Dr. Ghosh's presentation earlier, in India, we have been doing some work on resource efficiency, where we're looking at, Government of India has come out with draft national resource efficiency policy, and at TERI, we along with European Union actually had worked very closely with European Union and the Planning Commission here in India, which is now called NITI Aayog, to basically come out with this draft for MOEFCC on resource efficiency. And to begin with, we are not so much looking at, if you look at waste sector, we are looking at municipal solid waste, of course, and also construction and demolition debris. where there are potential to use them, recirculate them in the economy, and also certain industrial sectors like automobile, renewable energy, and such. So there's some work which is going on linking resource efficiency aspect into circular economy, and how resource efficiency can actually feed to achieving circular economy. So I'll stop here, Professor Ghosh, and then come back again.
Thank you. Thank you. I would like to hear from Sanchita Jindal, because you know that she has done a lot of work on regulatory part is concerned. So in that way, how our regulatory framework in India is supporting the recirculation of resources or circulation of resources.
Okay, good morning, my Nigerian friends, and good afternoon, good evening, all Indian friends, and thank you very much, Professor Ghosh, for giving me this opportunity. Coming back to the subject, like how we introduce that resource circulation into the system. There are quite a number of what do you call the initiatives the government has introduced. You must be knowing that 2016 rules, all rules, be it the solid waste management, plastic waste, biomedical waste, construction and demolition waste, e-waste, hazardous waste, every rule has the component of waste hierarchy and circular economy. Coming back specifically to solid waste management, we have introduced the whole philosophy of rule or the principle of the legal system is zero waste going to the landfill. And how zero waste going to the landfill means the whole waste, whatever we have started realizing that this is no more a waste, this is wealth. This has so much resource into it. And there was an estimation done that you must all be knowing that India is generating 62 million tons of waste per day. And it is estimated that it has a capacity of generating 434 megawatt of electricity energy, 1.3 million cube of biogas, from which again 73 megawatt of energy can be generated. So this is all basically the resource into keeping resource into the circle only. So now, as just now Ramiki, expert from Ramiki has submitted that cradle to grave. But now we say there is no grave. This is always cradle to cradle, because this is a circle. There is no grave. There is no waste. So in the legal system, if you see, we have introduced quite a number of regulations where we have promoted the recycling. Coming back specifically to biomedical waste, if you see, all the waste which is in red, blue, and white category will be sent to recycling after sterilization or disinfection. Only the infected waste, which is the yellow category, will go to the incinerators. And you must be knowing that they're now because the government is part of the Stockholm Convention, where again we are talking, the government is taking all steps for going from the non-incinerable technologies. So in that, the government is encouraging the pyrolysis as well as the microwaving technologies for destruction of infectious waste also. And recent CPCB guidelines are all promoting the waste. And I'm happy, so happy that CPCB has finally come out with these guidelines, which segregate between the waste which is generated from the quarantine or the COVID waste and the general waste. Because earlier the general waste also, people were so confused that whether the general waste, the mask, and these are the infectious or hazardous. And you must be knowing that Ministry of Urban Development, they had classified mask also even as the hazardous waste. So now CPCB has come out with the clear-cut guidelines and making all these as reusable by keeping these for 72 hours separately in a bag. Only the COVID waste, which is from the hospitals or the healthcare facilities, will go for the incineration. Remaining all can be recycled. So these are all efforts towards resource efficiency and circularity. Thank you for now.
Thank you.
Yeah.
Thank you. And to add to you, we from BIS, Bureau of Indian Standard, we are also preparing the procedure for disposal of all these things. And maybe in next couple of months, this will be also released. We are in the process of preparing that. Thank you. Thank you. I have seen that Dr. Fasawe, you are involved in the, as a CEO of Lagos State Environment Protection Agency. That means it's a sort of authority for waste management and environmental protection. So in that way, in Nigeria, there are huge amount of waste and a number of landfill or rather dumping is happening. So in this situation, what are the steps and the framework for recirculation of waste in Nigeria?
Thank you.
Please.
Good afternoon.
Good afternoon.
I hope we can you hear me?
Sure, we can hear.
Okay. Good afternoon.
Yes.
Thank you for having me here. I would like to refer to the last speaker. Did she say that you can reuse face masks? She mentioned something about face masks being reusable. Yes. Yes, please.
Yeah, No, I didn't say that face mask being reusable. There are guidelines that cloth face mask can be reusable, but the disposable face mask need not go into the hazardous waste, which ultimately goes for the incineration. The disposable mask can be kept for 72 hours from the general waste. I'm talking about the household mask, not from the healthcare waste. So general public, earlier it was the guidelines were issued that even the general public face mask should be put into the hazardous category. So now the disposable face mask can be put outside for 72 hours and then can be sent into for the recycling.
Yeah, please.
Not reused. It cannot be reused.
Thank you very much. I needed to clarify that point.
Yeah.
I'll be speaking from a Nigerian point of view. Corona is new to all of us, and it has brought out a lot of things we have ignored before now. We have a proper guideline and protocol for managing medical waste. All of a sudden, everyone is using face masks, hand gloves, scrubs, disposable this, disposable that. And it's interesting that I'm coming from the angle of pollution control, environmental protection. A lot of these single-use materials, disposable, like you say, most of them are made from plastic, non-degradable plastic. So it then gives us a big assignment to think of alternatives, how to recycle, and how to dispose of them without causing environmental degradation, which is what we're seeing a lot of in Lagos now. Like the professor said, our landfills, our drains, our secondary, primary, and tertiary channels for water flow are being blocked by these non-degradable substances, which poses a totally different headache from creating wealth and recycling and circular economy. It is causing water pollution, land pollution, and sometimes there's open air burning, air pollution. And as a DG of an environmental protection agency, our headache is new. We've not been challenged with this before now. As much as we are preaching a circular economy and making producers like Extended Producer Responsibility Act real, it becomes almost impossible, as my friend, the previous speaker said, to track, especially the domestic use, single-use plastic, or reusable, or face masks, or whatever we want to call it. They end up in our drains. They end up blocking drains and causing floods here in Lagos. They end up in the tummy of fishes and animals. They end up, creating all sorts of hazards we didn't consider before. So what we're doing in Nigeria, well, in Lagos State, is thinking of, yes, circular economy, yes, waste to wealth, but at the same time, how do we improve our advocacy? Like the previous speaker said, a lot of people, especially domestic use, do not understand proper disposal of hazardous material or non-hazardous in the case of reusable face masks. We're putting together a strong advocacy channel through media, information, education, town hall meeting on safe and responsible disposal of this waste that have come with the advent of Corona. Before now, when we talk about, hazardous waste and medical waste, we're thinking about the sharps and body tissues and all. But more of these single-use, non-degradable plastics are coming from the hospitals now. And when they're called non-degradable, what do we do with them? Recycle, reuse, rethink, and find a way to close the loop. I'm happy to be here because I have my pen to learn a few things. And that was why I found reusable face mask comments quite interesting. Thank you. That's what I have to say for now.
Thank you. Yeah, we are concentrating here only on the recirculation of resources. We are not considering at this stage in the question the COVID waste. We'll come back to that later part. So I am interested to go to Maria, Dr. Maria. Please respond to this question, this point, that what you have.
All right, thank you very much. All right, thank you very much, Professor Ghosh. Good afternoon, everyone. It's nice to be here. And I'm glad to share a bit of what we have been doing in UNILAG and what we hope Nigeria will turn out to be. Like Professor Ghosh said, I'm indeed glad about this meeting because the issue of environmental waste management cut across sustainable goals. I wish I could share my slide, but I cannot at this stage. Like goal 3, almost all the goals is involved in environmental management waste. In Nigeria, we are yet not there. We are still far, even though 2030 is almost here, but we are still very far from getting there. But we must transit towards a more sustainable circular economy that contributes to resilient environment and human being health. But the problem we have in Nigeria that I observe, but which is being corrected now, is the issue of disconnect between the lawmakers, the policy makers, and the other stakeholders, most especially the academia that are responsible for the provision of evidence-based policies in Nigeria. But I'm happy because now I know I'm involved with a group that is trying to advocate for evidence-based policy making in Nigeria. Because even though this policy has been out since 2018, we don't have access to it. So researchers do what they want to do. We don't know what the government wants. We just do what we want to do. And on the shelf lies a lot of information that can be used for this circular economy that will generate income and also prevent hazardous pollution that could affect the health of the populace. So transiting towards a circular economy in Nigeria, we need to bring together different group of people, the stakeholders and all that to come together. You know, it shouldn't be information moving from the upstream alone, but it has to come downstream And I'm sure it's because the information is not properly passed on. That is why we still have waste being thrown here and there. It will amaze you that you could see protection equipment all around the field and all that. But I will just jump because of the time. I will go to what we have been doing with this waste. And I want to say whether it is hazardous waste or not, even the kits that we are talking about, they could be decontaminated and be used for other purposes. You will discover that whether you are talking about hospital materials, industrial materials and all that, they are all made of plastic, either plastic, newspaper, textile, wood, food waste, fuel and all that. All this waste can be converted and be reused again for the economy. On my own side, I have tried to do a bit of this work. I have tried to propose that biodegradable plastic should be encouraged to make most of these equipment and materials, whether hospital or home use materials. We have to learn to graduate into biodegradable materials, that is bio-based, made from plant material that could be easily degraded and reusable. On our side, we have tried to use waste, various kind of waste.
Okay, thank you. Thank you, Dr. Maria. So we have with us Onipede Wusu, but as she was not here during this program for the last question, so I'll go to her for the next question. So you know that Nigeria, on its one part, the ocean, and as the previous panelist was telling, that there are a lot of plastics and non-biodegradable waste which are going to the land, which are going to river, drain, and all these things. So in that way, it prompted me to discuss on the.
Okay,
it prompted. Kindly mute your microphone, please. Kindly mute your microphone, please.
Okay.
Kindly mute your microphone.
Okay, is that the end?
Please mute your microphone. I'll ask you again whenever you will be speaking. Okay.
Try to mute, but it's.
Even if you don't mute, you don't speak, then it will be okay. All right. Thank you. So in that way, marine littering is one of the very important issue for all of us. For India also, we have nearly 3 sites where there are Indian Ocean, Arabian Ocean, and all these things. So, Indian Ocean and Bay of Bengal, all these things. So, I like to bring this point that how and what are the actions both the country, the marine littering. I mean, anyone from India who can respond to it, either Dr. Pandey or Sanchita Madam.
Good afternoon, Dr. Pandey. Would you like to take this question, or shall I go ahead? Okay.
Go ahead.
So, like for marine litter, my question is like, hello, yeah. So for restricting marine litter, all the world over, there are so many programs going on marine litter the restriction. But for the, if we go like that, why marine litter? Because we are littering on the streets. As such, for so many years, people had been maligning the plastic per se. But what I see that plastic has brought out so many new dimensions. It has reduced so much material. It has reduced so much carbon footprint. It is we who are.
Excuse me, Mrs. Jindal. Excuse me. I'll just interrupt.
Yeah.
No, we don't want to listen all those things because everybody knows it that what is happening. But I am interested mostly what the country has taken action to prevent marine littering. That is more important.
Okay, so first of all, we had the plastic waste management rules. You all must be knowing. The country has introduced plastic waste management rules. In that, specifically, we have brought out the provision of EPR. That means all the producers which are introducing their product into the market, they will be taking back their plastic waste and they will be responsible for taking it to the logical end, be it recycling, be it disposal, whatever. Secondly, we have so much emphasis now going on the recycling of plastic waste. Thirdly, we have the full-fledged program for cleaning up of our bays, what do you call, the beaches, bays, and as such the ocean, the ministry has now have the ocean marine ocean cell in the ministry for restricting and taking programs for the reducing the marine litter. Secondly, the ministry, probably not the ministry, but all the institutions, they are coming out with the big awareness programs to make the people aware that if they litter, ultimately it goes to the marine and how it causes the effect on the marine ecosystem, which is so important to us from my side. And secondly, the resource efficiency policy would also emphasize the reducing the marine litter.
Thank you.
Thank you.
And you have, I'm quite sure that you have some other points in your bank, what Dr. Pandey may be speaking. But before that, I'll go to Professor Wusu, Onipede Wusu. If she's here, I believe that you are here.
Yes, sir. I'm here, sir. Good afternoon.
Oh, yeah, good afternoon. And we could not introduce you because you are not there. So thank you very much for joining.
I'm sorry for coming late.
All right. Please, if you have any point on this particular issue, please respond. What Nigeria government is taking steps to prevent marine littering?
Thank you. I know that there is a fundamental challenge in Nigeria. And that challenge is for our policymakers to connect with those of us in the academia, responsible for conducting research and all that, to figure out, some of these challenges and how to, find solution. I know we have School of Oceanography, we have ministries that are responsible for all these things, but frankly, Nigeria does not have anything I can call a workable, solution to even other types of wastes, even the ones on, waste, domestic waste, and all that. That we expect, state government officials to come and pack from various things. The management of those wastes very poor, very poor.
Okay.
And
all right, we got your point. We got your point, Professor Wusu. Now I request Dr. Fasawe, because she is from the authority, government. So we like to hear from you that what are the actions or the plan for the government to take up for anti-marine littering. Dr. Adedolapo.
Okay, I didn't get that. Please, can you repeat that?
Yeah, we were discussing that that Nigeria and India both have a part just beside the ocean. Okay, so it has a quite a bigger length with the ocean itself. So in that way, there are potential to marine littering and affecting the ocean. So in that way, what are the actions? Like India government has taken up some of the actions. Similarly, many other countries are taking up. And this problem, as you were telling, that drains, river, and water bodies are getting choked with the plastics and others. So have you had any action point from the government, either already have been done or it is in the planning side?
Okay, we already have a coastal cleanup task force already, and there's the National Maritime Agency that takes care of the high seas and the coastal areas all over the country. But Lagos, as a coastal state, we have ports, about 3 or 4 seaports, and we have government agencies deliberately set up to ensure cleanliness, and part of their activities includes, but is not limited to, gathering plastic waste and selling to off-takers that recycle. We have different points where you can pick up, but it's government's responsibility to pick up because the off-takers will not pick up for you. So we pick up, clean, and sell to recyclers. And whatever funds we generate from that, we send it back into the system to get more pickers. There's no miracle. We just have to pick up and put out security against beach goers who just throw things about. But we also know that plastic waste can be sent from the east coast of the country and it flows all the way to the western coast. And after a big rain or a big ocean surge, everything is littered there. There's no magic. We have to physically pick them up and we sell to recyclers.
Great, thank you, thank you. And Professor Dr. Maria, if you want to add some additional points. Dr. Maria.
Yes, sir.
Yeah, please add if you have any additional point what she said.
Yes, like I said, there's a synergy going on now between the policymakers and the researcher. But we have been trying to convert waste into biogas and biochemicals that are used in the industries for now. Now, my group is also working on pyrolysis, whereby we can convert our waste into tiles and other valuable items. But I can tell you that we still have a long way to go. But we are in the right direction. We are not yet there, but I'm sure in the next 2 years, when there is synergy between the policymakers and the evidence providers, which are the researchers, we will move forward from where we are.
Thank you. Thank you. Thank you, Maria. Yeah. Fasawe has some point to say. Please, yes, go ahead.
I would like to talk to Dr. Maria and to the group generally. We in Lagos State have realized what she keeps talking about. There needs to be a synergy between us policymakers and people who have objectively verifiable data. And that we can only get from the academia. I want to add also that Lagos State is, well, the Ministry of Environment is in partnership with the Lagos State University. And possibly after this meeting, I will reach out to Dr. Maria in coming up with a sustainable pyrolytic system set across different parts of the state, government controlled. The same way we have central sewage treatment plants, the same way we have effluent treatment plants, we're thinking of pyrolysis as something that can be set up in strategic places based on the information we have gotten from the academia. Right now, we're working with Lagos State University, but I'm happy for a synergy with University of Lagos. Dr. Maria, I would reach out to you after this meeting.
All right, you're welcome, ma. Thank you.
Thank you, Dr. Fasawe. I'm really very happy that this platform could evolve something towards a solution, that synergy between the agency, the government agency and the university, that is the success of this type of webinar. And now I'll go to Dr. Pandey Because you know that whenever Sanchita Jindal was saying, it came to my mind that one of the very important issue which government of India has taken for the anti-marine littering is the single-use plastic banning. So if you can say something on that, that will be helpful for the participants and the panelists.
Yep, single-use plastic, as you said, sir, was to be banned last year, actually on 2018 itself, on the World Environment Day, it was announced that some of these single-use plastics will be banned. And then the committee was set up under Ministry of Petroleum and Natural Gas in the country, because that's the ministry which deals with most of the petrochemical industries and also manufacturing of these stuff. But what was realized is that in India, a lot of manufacturing of single-use plastic is dependent on small and medium-scale industries are dependent on for their livelihood on single-use plastics. So actual ban was deferred for some time, and the committee was again looking at what are the items which are most unavoidable in terms of their alternatives, which are most avoidable in terms of their alternatives, and which can be banned immediately. And committee is still deliberating on that, and they'll come out with the list of those items which can be banned. But I mean, obviously, COVID was not helping because of the fact that a lot of waste collection and recycling has actually stopped because of the lockdown which is imposed. So once the situation goes towards normal, the Ministry of Petroleum and Natural Gas will come out with this list as well.
Sure. Thank you. Because COVID has retarded everything. COVID has retarded everything in all the countries together. Right. Yeah. So, in fact, one point which is very much pertinent in developing this waste management, recirculation, circular economy, and all the policies, that synergy between the government, researcher, and the industry partners. So, can you give us an example of what is happening in India in, like, you know, that co-processing? The co-processing standard, I was one of the expert committee members. So we made a consortium of industries, researchers, and the government. And we came out with a document which is now becoming acceptable to industries. And as a matter of fact, waste management is becoming easier with respect to the waste to incineration, co-processing is concerned. Similarly, Jindal and Dr. Pandey, both of you, please give us some example in short, so that will be also a learning point for all of us. Whatever experience you have and you worked in those. Mrs. Jindal, pehle aapka.
No, I didn't get your question. What do you exactly, what example do you want in what sector? I didn't get your question. Sorry for that. Yeah.
All right. This question and the point is for both Nigerian and India. Like, you know that from the Nigerian point of view, Dr. Maria and Fasawe, what point came out that there must be a very robust synergy between the government agency, researcher, industries for tackling this waste management and recirculation of waste issues. So in that way, there are many initiatives I know in India which has been taking up with this synergy. Like one, I gave an example of the co-processing standard and other things. Similarly, if you have some experience of working in any of the committees like that, please give us some idea in short.
Yeah, I would add this thing like synergy, the plastic waste. Ultimately, there are 4 ways the plastic can be ultimately disposed of. Either we convert it into the oil, or recycle it, upcycle it, downcycle it, convert it to oil, or waste to road. The road is coming up now with a big what do you call, big sector where the plastic waste can be used. And this is a very good example of, because the country has now almost, that day you must have heard our Honorable Minister Nitin Gadkari, he had issued a statement that we are the actual doer, and we have made 10,000 kilometers of road with the plastic waste. So this is a very good example of plastic waste being consumed into something usable.
Yeah. Thank you. I like to go to Professor Wusu, if you have any experience such in Nigeria.
Well, such experience, I think, is it's not in existence, but I know there are steps towards that. I think there is one in Lagos State. Industries, some institutions set up to convert this waste to. But in terms of it working the way it should be, is a problem on its own.
Mm-hmm. Okay, thank you. I like to come to Dr. Fasawe, because she might have more information in Nigeria regarding this.
Well, I can speak for Lagos State. Professor, you're right. And that is why I said advocacy is our first step. Education, information, and communication with the general public. In Lagos, the informal sector is massive in waste collection and management. We're trying to streamline this. And as Dr. Maria has said, we're thinking of pyrolysis and setting up proper centers. And if we say bring your waste, plastic, for an incentive, in Lagos State, we have a committee looking into this. Incentives as far as paying your child's school fees and getting tokens. We're working on this, and we're working with the academia on it. It sounds daunting, but it is possible. And when it's done, it will be published for all to see. LASEPA as an agency, we have banned single-use plastic within the agency. And so far, as of today, we did that in December, compliance is almost 95%. And we are publishing a study to make it obvious to other ministries and departments, and even the general public, that it's possible to, deal with single-use plastic as something that can create wealth, not ban the production of it, because it will interest you to know.
Absolutely.
That most of the people that produce these things in here got loans from federal banks. We set up entrepreneurship, give people loans.
Yeah.
We bought them machines. We told them to make these things. In Lagos, there's something we call pure water sachets.
Very good. Yeah. Fasawe, I like to stop you now here. I want to go to Dr. Maria. So as Lagos is having some sort of framework of doing this, Dr. Maria, do you think that this type of venture can be extrapolated to other states in Nigeria, or no?
Yes, it can, but time will tell. Because I can tell you the truth, Lagos is the lead when it comes to waste management. And Lagos is not yet there because of the level of waste that is being generated in Lagos. So when Lagos are actually, other people are queuing behind Lagos. But what we intend doing is, by the time Lagos gets it very right, then, and by the time the lawmakers begin to agree with the academia, then it can begin to move from one state to another. We have about 36 states.
Yeah. So Maria and Fasawe, to both of you and also to other panelists and the members, this is a submission from my side as an Indian, that the persons who are here as panelists from India, like Mrs. Sanchita, Dr. Pandey, me, and many other friends here, we are always open to any sort of cooperation for Nigerian waste management and resource circulation. So anytime if you need any inputs or any other services, please let us know. So in that way, always a good relation with many of my friends are in Nigeria, and that's why we are holding this webinar very successfully. I'm very happy. So in that way, we are always with you. So anytime you need any help or cooperation, we are always there. So the
Okay,
last
sir.
point. So the last 2 points. First is, you know that Nigeria and India has a similarity with respect to the unorganized waste speakers are concerned, because people who are very poor and who have all been getting their livelihood earning from the West, which they are picking up. In India, there are a number of initiatives which have been taken for converting this informal sector into formal sector. And we have given them health card, we are giving them insurance, we are giving them the dress and many other things, and also a minimum wage pattern. What are the things happening in Nigeria? Do you have any such plan or any case study?
Is the question for me?
Yeah,
Okay.
Maria.
Okay, but thank you, Prof. But I want to think the lawmaker should be able to answer that question, because we have a major challenge in Nigeria: funding. Most of the things we have been able to do, we've gotten funding from outside Nigeria. So far, I've gotten a small fund from Nigeria, which is barely sufficient to complete my research. So by the time, I believe that by the time the policymakers begin to appreciate what we have on the shelf and we begin to make use of it, probably the confidence will be there to release money. I know there's no money in African countries, but if you take it as a priority, then there will be a way.
Okay, all right. So before I go to Adedolapo or any other Nigerian, I like to ask either Dr. Pandey or Mrs. Jindal if you can give some light on this point. What is happening in India? Dr. Pandey.
So what's happening is, we have been very successfully working in some cities with these informal sectors. And for the dry waste, for example, we have been creating models on something which is called material recovery facility, which are being set up in different parts of the cities, where the informal sector working with the local NGOs or community-based organizations are collecting waste in a segregated manner because of the country's emphasis on segregation of waste, and doing further segregation of dry waste into various components, paper into various categories, glasses into, say, white, green, brown, and similarly plastics as per polymers, heavier polymers, lighter polymers, so that they can be sold further to traders or recyclers at a better cost. So that is helping them improving their livelihoods. In fact, some of the waste pickers have been so well organized that they are actually operating mini waste processing centers, where they are not only sorting waste, but if they are getting some wet waste, they are composting it or installing a small biogas plant and utilizing the gas. So that experiment has been pretty successful, and which I think we can also share very successfully with Nigeria in case if they're interested in replicating such models there.
Sure. I request all the panelists to please put off your microphone. All the panelists to put off your microphone. Only once, whenever you are speaking, please put off. Yeah. Now I like to request. You know that for Nigerian people, mainly the authority, I'll tell you, this is my view, that during this COVID pandemic and post-COVID pandemic, people are getting poorer and poorer. There are no jobs. So in that way, instead of pushing all the waste to the landfill side, it is the right time to have the material recovery facility. Why I brought this point? Because from the material recovery facility, we have number of business model, as Dr. Pandey was saying. So in that way, these poorer and poorer people can be involved in separating this waste and this will make a wealth. At least they can survive, because where there is no job, that is the easiest job what we can do if government gives some support. So I like to come back to Dr. Fasawe. Do you have any such thought process? Dr. Fasawe, you are there? Yeah, Dr. Fasawe, could you hear us?
Professor, I would also like to come for this point. Yeah.
Yeah, let us first listen to him, her. Fasawe, okay, so possibly she was busy.
I was a little distracted. You're right, Professor.
No, it's all right. Let us hear from Dr. Maria and all right. We'll come back to you again. Dr. Maria and Professor Wusu, do you have any point? I mean, specific point, the material recovery facility and how it can be brought forward. Even if the government doesn't have the thought process, we are the researcher who have to encourage them and give them the idea that this can be done. So Dr. Maria and Professor Wusu, anybody, if you like to add.
All right, Prof. Honestly, Prof, I can tell you we have great ideas. Even personally myself, I have drawn up a lot of things which we can do with waste, but through which even till I retired, I cannot finish. But it's the truth. But I prepared slide, but I didn't know we will not be able to present. We have a whole lot we can do with waste, and if we do that, the issue of joblessness will reduce, and people will be able to find job, and the issue of waste will be reduced. Because I use two methods. It's a double-edged method of removing waste and conversion of the waste. So that at the end of the day, nothing is wasted, because really there's no waste.
Thank you. Professor Wusu.
Prof, thank you. I like to say this. If our discussion is to, address frank and to address
Please
issues.
mute your microphone. Please mute your microphone who are not speaking. Please mute your microphone. Maria, please mute your microphone.
Okay.
Yeah.
Okay. Oh, it's still making noise. Oh Lord. Okay. Thank you, Professor Ghosh. I was trying to say that if we are discussing sincerely and we want to deal with, issues affecting India and Nigeria sincerely, I can say that our major challenge is our policymakers, our decision makers are simply irresponsible to the citizenry in many ways. So this issue you have raised, I know that it is a dream and it will remain a tall dream. If, judging from what our leaders, the politicians, and those who are supporting them, do around here, I will be frank, that will be a tall dream with what is on ground. Thank you.
I'd like to speak to that. Professor, where are you speaking from, sir? Sir, when you say around here, are you speaking from Lagos, sir?
He's muted, so I think we can go ahead.
Okay, well, yes, I'm speaking from Lagos.
I sit on this panel as a policymaker and an environmentalist. And I beg to, I crave your indulgence to disagree that government is not responsive to the situation on ground. Like I said earlier, it is massive. It appears daunting, but at fora like this, we have opportunities to start something. I just sent a private message to the person that invited me to here to give me Dr. Maria's details. As the professor has said, you have the data, you have the ideas, share with the policymakers. Well, as LASEPA, I'm interested if I can ban single-use plastic in my building because we have not been able to do it in the States. It should encourage someone out there. Please visit our website and see that, okay, someone is trying to do something. Let's support them. We're policymakers, but you have the tools and the analytics and the know-how. So, Professor Sir, I am happy to share my email. And Dr. Maria, I will be reaching you after this meeting. The government there are different competing demands for limited resources. It is how much of a voice that the environment has and waste management has that will force the arms of government to do things. Thank you.
Okay, I just know that. Sorry, Professor Ghosh.
Okay. Please.
Okay.
I can
right.
I can sympathize with you.
Sanchita, madam, please. Because you know that our time is up to 7 o'clock, so they will force close this meeting now after few minutes. So in that way, let us conclude now. One thing, we want to have some collaboration with Nigeria. So in that way, as it has cropped up from this panel discussion, that can we have a collaborative effort for developing only one dry waste collection center and processing center, which we call MRF, Material Recovery Facility. Let us take it in a very small way. And as Dr. Fasawe, as I know that she is a very active lady, and Fasawe, we are all here. Can we take up a small project?
What's MRF?
Yeah, Material Recovery Facility, because that is separating dry waste from the wet waste, and this dry waste will be recycled in an organized manner, and there you can involve quite a good number of people who are poor people, and they can earn their livelihood from this with all the facilities like giving them insurance, giving them health facility, giving them all these things. So the detail we can discuss later on, but if not only the panelists, all of us who are here from Nigeria and India, at least if we can take up this very small project between India and Nigeria, this will be the success of this webinar. Because we have spent a lot of time today and for last 15 days. If it can happen, that will be the best part of this webinar, 3 hours webinar. So if you all agree, I mean, the
like that we can also study. Can you refer me to a facility like that I can look up online?
Please, please. And Dr.
Professor Ghosh, just one small interruption. The MRF which we are talking here in our country, MRF is now getting completely mechanized. Automatically the machines, based on their density, based on their texture, based on they separate the things. So this is not inclusive of inclusive of the informal sector. This is exclusive of informal sector, and informal sector is getting out of it. So we should have some model which includes informal sector and includes their livelihood, increase their livelihood.
In fact, we don't have much time. That's why I'm just rushing. We can work out in detail. Only thing is that principally, if we agree from this platform, this will not be a government activity now. After some time, maybe this can be acted as a government activity. But let us take up a project from this webinar platform, and we will form a committee. Dr. Fasawe and some other, Dr. Ola is there, Mr. Ola is there, our Aremu is there, and all these things. So let us come out with is that there are many problems which we have discussed, but only one solution if you can make and if you can develop from this webinar platform, that will be very much helpful for all of us. I thank all the participants and the panelists who has given their right thoughts and very openly they have discussed the detail. So with this, I conclude this panel discussion once again and thanking all the panelists for their valuable time spending. So now I am handing over this to Yusuf. Yusuf, you have only 4 minutes time, 3 minutes time, because 7 o'clock this will be closed.
Okay, thank you, Professor. I want to thank the International Society of Sustainable Waste Management, Air and Water, for giving the platform to organize this wonderful webinar on this very contemporary issue. I thank all the collaborating organizations for their support. And I have a few announcements for us. Number one, I want to cordially invite all the researchers, officials, experts, and scholars to submit articles to the 10th International Conference on Sustainable Waste Management Towards Zero Economy, to be held in December between the 2nd and the 4th of December 2020 at Kolkata, India. Submission date of full article is the 31st of September 2020. That is the deadline, and the details of which will be sent to you and available, and they are also available on the website of www.iswm.com. We cordially invite you, or secondly, we cordially invite you to submit your articles for the book COVID-19 Compendium or Countermeasures to be published also. And lastly, is that your certificate of participation to all the participants today. We are so grateful, and your certificate of participation will be available at the link that has been shown in the chat box as per the link and as per your alphabetical orders. I hope you enjoyed the webinar. Thank you so much. Do have a nice day.
Thank you, everyone.
Thank you. Bye-bye, everyone. All the panelists, thank you.
Okay.
And thank you,
Thank
Dr.
you.
Ghosh,
Bye-bye.
and all the
Okay.
Nigerian partners. Thank you. Bye-bye.
Thank you. Bye-bye.
Bye. Bye-bye.
Professor Ghosh,
Thank you.
Thank you. Bye-bye.
Bye.